on somebody like this, how many lymphatic enzymes would you put them on a day, and how many protease and amylase? Would you do all of it? I mean, would you do protease, amylase, and lymphatic enzymes? And in this case, how many would you put them on a day? About
this individual would certainly benefit from all of the different enzymes, but you do have your one contraindication for your lymphatic enzymes when you're dealing with the mucoprotein here. The mucoprotein is protein and carbohydrate. The carbohydrate's going to get broken down into what? Into sugar, into simple sugars. So if you have a person who's diabetic or extremely hypoglycemic, you have to be a little bit careful with the lymphatic enzymes or even the concentrated protease and amylase, because if you're getting out there and digesting up a tremendous amount of the mucoprotein, you can really elevate the blood sugar quite a bit. So a lot of people where they have some perhaps some borderline diabetic tendencies, you might not want to just rush right ahead to high dosages like 3 times a day or something like that of the lymphatic enzymes, because their body might not be able to handle it yet, and you might need to start them off very, very slowly on maybe once a day and just kind of see how their system handles it. If your blood sugar goes up as a result of taking a lot of lymphatic enzymes, what's a very, very common symptom that takes place? Anyone? How does the body deal with excess blood sugar if it can't handle it from the pancreas? You're going to send it out through the urine. So how many of you here have taken a big bunch of lymphatic enzymes and then found that you've had to urinate 2 or 3 times in the next hour or so? How many have had that? Okay, so that's showing you that you're putting more sugar into the blood just from the lymphatic enzymes. I mean, I'm talking, you've had that on an empty stomach, right? Right? That's showing you that you're getting an elevation of blood sugar that's more than your pancreas is capable of handling. So your body's, kind of kicking in the second line of defense against too much of a blood sugar, and it's going to just urinate off the excess. Some people can't take lymphatic enzymes before they go to bed because they have to get up. They might end up having to get up 4 or 5 times to urinate, or they might be up all night with, high blood sugar and too much energy to go to sleep. So you've got some other things to consider.
I know if I take too many, I start shaking. I just start shaking. And also, we've had people that if they start taking too many, they start really draining from the nose and everything, and you're just blowing your nose all day long. So if you're in a work situation, it might not be practical.
Elaine?
Can you ever see in the eye signs of excessive candida overgrowth?
I have heard of some iridologists that claim to be able to do that. I've never seen anything that was all that convincing to me as far as something that was actually consistent. Like if you see this, there's candida. If you don't see it, there isn't candida. I've never seen anything consistent. I think Nimrod was next. Or Ian, were you up there?
Since someone has got enough, if lymphatic system is clogged up due to excess protein, is it advisable to continue taking more protein-like supplement?
You need a certain amount of protein, not just to maintain the body, but to regenerate. After all, the process of regeneration means your endocrine system has to work properly, which means you have to have the hormones, which are, built in part out of your amino acids. So there's no question you're going to continue to need a good protein source, particularly a good raw protein source where you haven't destroyed any of your amino acids. The glitch is that it's not just a question of taking in protein, it's a question of making sure that you actually digest and assimilate it. So what you need to do is, yes, keep taking protein, but take very high levels of your enzymes, your food enzymes, your protease and your amylase and so forth, so that you're going to digest the protein. Because you want to make sure you're not going to accumulate more. As long as you have enough enzyme activity, you're not going to build up any more of a mucoprotein buildup. I might add that with the grain fields where it's pre-digested, it's already broken down into amino acids. It's pretty unlikely that you're going to run into much of a mucoprotein problem with that, because you don't have protein chains to begin with. You've got free-form amino acids there. So the grain fields would be a real blessing for anybody who has problems with the protein digestion.
Here, now I cease to be a disembodied voice on the tape. On the lymphatic enzymes, what is the difference between taking them, say you're taking 6 to 8 a day for a condition, what's the difference between taking them on an empty stomach or with food and or other enzymes?
Well, basically, Tom, if you take them with food, part of them may well get used up in digesting the food, which is no big deal. Whatever's left over will get out there and digest the mucoprotein. Back 7-8 years ago, John used to be very insistent that they be taken on an empty stomach, because the idea was to get them out into the small intestine and out into the system where they could get at the mucoprotein. But what we've seen over the years is that if you ask people to take them on an empty stomach, they don't tend to take them very often because they forget most of the time. So it seems to be easier to just have people take them at the meal times along with their other supplements and just hope you got enough excess enzymes to where some of them are going to get out there and work on the mucoprotein.
So if you had a condition that you really wanted to break up the mucoprotein, you would insist then that they would take them on an empty stomach for better results?
I suspect that if they have enough extra enzymes with the meal, it may not make that much difference. One thing I will say about the lymphatic rosary and the mucoprotein buildup, it's going to be related to a malfunction of the thyroid. And, of course, the thyroid's clear up at level 3. So most people, virtually everybody's below level 3, below the anger level. So it can be a difficult thing in many cases to get the thyroid to get the mucoprotein to completely disappear, because as long as the thyroid is not working properly, your protein metabolism is not all it could be. So there's a lot of other factors you might have to look at in addition to just the digestive system and the lymphatic enzymes. Or you might have to consider the thyroid and there's probably other factors that I'm not aware of in there as well as that. Graham?
Is the body then able to actually reutilize the mucoprotein, or does it just end up getting excreted like junk?
As far as I understand, the mucoprotein is going to get broken down into amino acids and simple sugars, and it wouldn't seem like there'd be any reason the body couldn't use it. It's just, just simple sugars and amino acids. I mean, obviously, if people are getting that response of, extra energy when they take the lymphatic enzymes, or perhaps having to urinate a bunch of times because the blood sugar, is too high, that would seem to indicate that the sugar is getting into the bloodstream. And I don't think there's any reason that the proteins wouldn't do the same and wouldn't get out into the tissues, because all you're really doing with the lymphatic enzymes is breaking down the linkages within the carbohydrate protein complex and liberating the constituent parts, which are your amino acids and the simple sugars there. Okay, next slide. Okay, this is another example of a very, very congested zone 3. And as John said earlier, when you've got the heavy mucoprotein buildup in zone 3, where you see all this rust-colored pigmentation right outside the autonomic nerve wreath, this is going to mean that the assimilation is blocked, meaning that, no matter how much nutrients you take in, you're having a difficult time actually getting them out to where they need to go, getting them out to the cells. And so obviously we're going to need to clean up the intestines as well, because if the assimilation is not right, obviously one of the things you're going to need to deal with is going to be the small intestines. What are some ways to clean out the small intestines? Okay, the alfalfa. No, the irrigation's not going to do the small intestines. The water's not going to make it past the ileocecal valve, so you're not going to get any. You got to clean the small intestines out from the top down. So you're dealing with things like your alfalfa, and also your psyllium, or what they call your isabgol, which is going to be, or flea seed, some will call it, which is going to get in there and clean out the small intestines there. A lot of people will have a lot of debris lining the small intestine, which will make it very, very difficult for the nutrients to get out to outside of the small intestine and out into the bloodstream and eventually out to the cells. So we need to make sure we're keeping the small intestine good and clear. I might add another thing that's very, very effective at cleaning out the small intestine will be your, I'm not sure of the effectiveness of the figs and the other fruit, but the pawpaw or papaya, you'll find that the papain enzyme, this enzyme will work in any pH, whether it's acid, alkaline, or neutral. So it's going to do a very, very good job if you've taken, like basically if you've taken enough extra pawpaw, above and beyond what you need to digest the meal, it's not going to get wasted. It's just going to go through the stomach and the small intestine and on into the large intestine, and it's going to digest anything in its path, anything that's not supposed to be there. And in particular, it's going to digest a lot of the mucus and the sort of false linings of the intestines and a lot of the old debris that's impacted within the small and large intestines. So some of you that are going heavy on the pawpaw smoothies, you're going to find that your assimilation is going to improve quite a bit because you're going to clean out a lot of that old debris in the small intestines.
What about hot castor oil packs?
I don't really know. I can say from experience, back in Hawaii, we used to take, some of us used to take like a big handful of the compressed leaf alfalfa tablets along with like 2 or 3 great big spoonfuls of the mature green papaya powder, and we would take that on an empty stomach, and we would find that between the, shall we say, the enzyme activity of the papaya powder and the mechanical or scrubbing ability of the alfalfa, that it was quite common when you did that on an empty stomach to pass sometime like the next day just these big globs of clear mucus. And sometimes you could actually even see some of the alfalfa tablet, like not like whole tablets or anything, but you could see traces of the alfalfa tablet in there. And this happened pretty consistently when you took the papaya and the alfalfa together. It seemed to do a tremendous job of getting rid of all that old mucus in there. Carol?
There's a yogic practice called Shankar Prakshalan, which I've been. Do you know about that, Anita?
This is with the cloth.
No, I've been wondering. I used to do it, the short form of it, but I was wondering about its use for cleaning the small intestine with body electronics. No, the only thing that I was concerned about is that there's salt in the water, but maybe we could use Celtic salt. I haven't done it because I wanted to find out. But you have a mixture of salt water with lemon juice in it, warm water, and enough salt so that it's not intolerable, but there's a fair bit there. And then you drink 2 small cups of it at a time. You drink 2 small cups, and you do a set of 10 exercises, which are fairly easy. Anyone can learn to do them, and I'd be able to show anyone if they wanted to know. And they're designed to open the different valves all the way through the gastrointestinal tract and allow the water to flow through. So you drink 2 cups of water. You do the exercises 10 times each. Then you drink another 2 cups of water, and then you do the exercises again, and you just keep doing that. You can do that 3 times. Anyone can do that 3 times safely, and that's wonderful for constipation. It might take a couple of days to get it moving through. When I used to do it, it would move through very quickly. And that's like hosing your way through. And if you only do it 3 times, you're not ingesting a huge amount of salt. There's a longer form where you just keep doing that. It might take hours. You have to have a yoga instructor present. Sometimes people vomit, but you keep doing that until clear water's coming through the other end. So it's hosed all the way through. I never got to do that because I always had malaria fevers. They wouldn't let me do it. But I've done the short form quite a lot. So I was thinking I'd like to do it again. It might be good. And what do you think about the salt? Use Celtic salt. And if you do a longer form, you have to be on a very light diet for that next week, but the next day they have people, it's an Indian thing, so they have people eating rice and dal and ghee, lots of ghee with no salt in it to draw the excess salt out, but we could just use flax oil. We could have a lot of flax oil afterwards to draw the excess salt out. And yeah, I don't know.
I don't really know anything about it, Joe.
Yeah, maybe I'll just try it for cleaning out the small intestine.
To clean it? The question was, would you use spirulina to clean the small intestine? I would not really think of spirulina as something that would be overly cleansing. In fact, I think it's something, if you're taking it, you have to be a little bit cautious with, because I know when I lived on Maui, there was, back in the mid-'80s, spirulina was very inexpensive and plentiful. And a lot of the colon therapists used to tell stories about just washing out just all sorts of spirulina out of people in the colonics, because if you take too much of it, it really can just gum you up. Now, the new spirulinas that are out now that are dried at a much lower temperature, they may behave differently. I'm not as familiar with them, but I know a lot of people with their spirulinas have gotten kind of gummed up if they haven't taken enough water with it. So I would not think of it as a cleanser for the small intestine. I may be mistaken on it, but it wouldn't seem that way to me. Have you noticed that yourself, or you felt gummed up with it? Okay. Nolene?
What about aloe vera?
I know aloe vera will have a tendency to keep a person pretty regular. I don't know if it's going to specifically clean out the small intestine or not. Do you know anything on that? Yeah, I'm not real sure about that, Nolene. I know it certainly tends to help a person have more bowel movements.
One thing, if you have diverticuli, then they say that the aloe vera has a tendency to cover it over, where the impacted material kind of stays in the colon when you're using aloe vera. So I'd be careful in that kind of a situation with using it.
Okay, if we could get the next slide and the lights and door there. Okay, and the next one, Matthew? Okay, and now what number is that one right there? Well, we're probably dealing with more of the diverticuli right in through here, and perhaps with something in the, well, that could be adrenals right in there. I was going to say possibly rectum, but it could be a number of things. But let's just say we've got the diverticuli there. I want to go on to the next one, Matthew. Okay, again, you've got the mucoprotein buildup starting here in zone 3, so we know we've got the blocked assimilation, and you'll notice a lot of the kind of black sand and so forth inside zone 1 here. You see how it's very, very dark all in through there.
Now I've been taught all these wonderful and weird things, so I just want to get them confirmed. Is it correct to say that the mucoprotein started around the scurf rim or in zone 6 as the rosary, and has then moved in, and because of the congestion around there, it's affecting the organs on which it's sitting as well?
Are you asking if this mucoprotein has moved from here to here? You will find there will be situations where the lymphatic rosary will move gradually in like this and get a lot closer in. But I don't believe that this mucoprotein here used to be out here. I would say that that's definitely just formed right there in zone 3. But there are certainly situations where your lymphatic rosary, which is still in zone 6, is moving in, which is meaning that your zone 6 is actually moving in. Okay, next slide. Okay, thank you. Okay, you've got a set of intestines that's rather on the short, fast side. You can see how the autonomic nerve wreath is somewhat on the small side here. And you note all these lines here? These are called your what? These are your radii solaris, which you'll find a little bit further on in the program sheet. These indicate a host condition for parasites. You don't actually, as far as we know, see the parasite in the eye for the simple reason that the parasite's not part of the body. There's no nerve supply between the parasite and your eye because it's not part of you. But what you do have with the radii solaris it shows that there's a host condition for parasites, which some will consider a condition of lowered electrical potential. Esther?
Is it possible that on an eye with radii solaris there can also be diverticuli inside the radii solaris without being seen?
Yes.
Because I did an irrigation on Janine and she passed a ficalith, and on her eye chart there was no sign of diverticuli, so we thought confirmed.
You might have with a radii solaris that was moving through zone 1 and zone 2, it might make it difficult to detect the presence of a diverticuli there. You might not see it. Okay, next slide here. Okay, this is an example, going back to your couple questions back there, Tana. This is an example where this is still basically zone 6 here. It's just that as the lymphatic congestion has gotten worse and worse, the lymphatic rosary has moved clear into here. Okay? So this is the fact that the lymphatic rosary has moved in that far. That's going to be an indication that the lymphatic congestion is very, very, very extreme. I've never seen a situation in which the lymphatic rosary literally moved, the actual zone 6 lymphatic rosary. I've never seen one in which that actually moved all the way into zone 3. Have you ever heard of such a thing? But there's definitely ones like this. This is fairly extreme, actually, where it's moved in that far. Yeah. At any rate, that's going to indicate a severe lymphatic congestion, and as we covered earlier, you're going to need the lymphatic enzymes or the protease and amylase, and you're going to need to make sure you're digesting your proteins properly.
And that would affect the organs in which it's situated, is that correct?
Right, which is
yes.
in this case practically everything.
Yeah. To get into the radii solaris up the top there, is it correct to say that the toxins, or that it's coming from the bowels and the toxins are moving up and affecting the head area and causing trouble?
A lot of times when you have the radii solaris on the top like that, you could have a lack of circulation going to the head, and that could be an adjustment in the neck.
There's
the person would need to have an adjustment in the head, because you can see the radii solaris are all in the head area, showing a lack of nerve supply circulation going up into the head, so it could be a blocked vertebrae in the neck.
There are some people that will say that the radii solaris, say starting in here inside the digestive system and then going up into the brain, some people will take the position that this means toxins are supposedly going straight from the transverse colon into the brain. That doesn't make a lot of sense to me anatomically. I suspect that you're dealing with some sort of reflex thing. I can say from experience, however, that you see a person who's got a lot of these radii solaris where they're starting here in the transverse colon and extending up into the brain area. You'll find that these people will often have a lot of headaches and a lot of other sorts of symptoms up in the head. And if they get the colon cleaned out, like a lot of people after a series of colonic irrigations where they have this type of eye, they might find out that they don't have so many headaches as they used to have because the transverse colon has gotten cleaned out. But I'm not so sure about this whole idea that the toxins are somehow mysteriously going straight from the transverse colon to the brain, because that doesn't make a whole lot of sense to me anatomically. But on a reflex level, they seem to have a big effect on the brain. So you follow the line and you watch what it passes through, and these are obviously going well up into the brain area. And as Anita suggested here, if you're dealing with this problem up in the brain area, one of the factors that may complicate things quite a bit is if your neck's out. I mean, if you've got a lot of problems in the cervical area of the spine, you're not going to have the right, you're not going to have good nerve supply to the head. You're not going to have good circulation, so you're going to be very, very prone to problems up there. So a good neck adjustment might be very, very appropriate here. Okay, next slide. Sama?
Yeah, Anita, I was just wondering if you can dictate possible host conditions for parasites in the iris. Do you in your health center sometimes send people, for example, for a simple stool examination?
Well, we could, except that most of the time it doesn't show up. The results are not always correct on the parasites. Have you found that to be true also, Doug?
Working as I do in the United States, where I'm not licensed in any state as any sort of physician, I just don't have access to that sort of thing. So I'm not even in a position to tell, oh, go get a stool sample or this or that or the other thing. That's just not my training or anything. So I really have never done it. I don't have any experience in it. I don't doubt that there'd be a lot of discrepancies, but I have basically no direct experience in it.
Yes, well, in the lab that I worked in, we did have discrepancies where the results just did not come out correct on the stool sample. So I think once you get on the program and you're correcting everything, this is going to go anyway. If you wanted to do, there's an excellent parasite cleanse, the Helda Clark cleanse you can go on if you have really deep radii solaris. I'm sure you must have some kind of parasites in there going on. So I would do one of these really intense cleanses maybe, and then as you say on the program, you'll see that the radii solaris will go. Now I had radii solaris in both of my eyes, and you can see now that they're only in the right eye, the left eye. They're virtually almost all gone. Maybe I have one or two. But I used to have them all over the complete eye, in both eyes, all the way from the beginning, all the way to the outer edge. And in this side they've come in, and in this side they're virtually gone. Maybe there's one or two left. And that's from just being on the program. Yeah, they shorten from the edge of the iris. They keep coming in toward the pupil. Okay, so they come in like that, the radii solaris. But if you have real intense, strong ones, you might want to do a parasite cleanse. Helda Clark's, do you know the name of that book? The Cure for All Cancers. Hulda Clark, Huldaclarke. Clark? No E on that.
Elaine?
In Hulda Clark's book, she also advocates the use of a zapper, which uses frequencies between about 300 kilohertz and 800 kilohertz, or is it 800,000? I can't remember. Which is supposed to take out the parasites by using this similar vibration to the vibration that they actually radiate out on. Very similar to what we were talking about this morning. Have you come across that at all? And do you think that would actually be detrimental in the body?
I know I've talked to John, and I don't know specifically about those frequencies, whether they'd be beneficial or not. But I know John has told me in the past that he's seen situations where people have used different types of frequencies and even different types of pulsed electrical currents and things like that, where when it's been applied to the body, the person has just passed heaps and heaps and heaps of dead parasites. Yet, on the other hand, it seems to have quite a negative effect on the body overall. It appears to be a pretty severe suppression. Anytime you're dealing with different types of frequencies and things, you want to be very, very careful, because it's often a very double-edged sword, and you may be causing some damage to the body. I know one thing, or a couple of different things that we've seen to be quite suppressive overall to the body, which are very much in vogue now, are the TENS units, which some of you may be familiar with, TENS. which a lot of people use to relax the muscles. They're very common in like physiotherapy and chiropractic offices. The acupuncture needles that are hooked up to the electrical current, where the needles are, you're getting little zaps there. And the ultrasound, which a lot of people are also using. These are all things that will basically suppress situations in the body. People love them because they feel better. I mean, it takes away the pain and all, but you're actually suppressing things in the body. Now, the frequencies that you're mentioning, I don't know one way or another. But I would just say I'd be very careful, and the mere fact that you're getting rid of parasites using them doesn't necessarily mean that they're harmless to the body. They may also have quite an effect on the body. Vivian?
I was just wondering about Hulda Clark's. We did actually the parasite cleanse, but they have terrific, sort of huge amounts of black walnut and something else I've forgotten now, which I'd read in quite a lot of books, can be totally toxic. And wormwood. That's right. Thank you, wormwood. And I was just wondering, we were sort of in a real quandary. We didn't know whether to do it or not do it, and then we decided to do it. But I was slightly worried, about what we were doing. Could you comment? Thank you.
I would just say, for the short amount of time that you're doing it, I think it's effective. I wouldn't do this over a long period or continually. I would just do it once, and that's it. Yeah. And does she advocate doing it more than once?
We're supposed to stay on the program, I think, all the time, more or less. But then we went on to body electronics.
Yeah, I don't think it'll do any harm if you're doing it once or maybe twice, but after that, I would stop. Yeah.
See, driving out the parasites with an herbal parasite cleanse, you get rid of the parasites, which is great, but you really haven't solved the problem. I mean, you've still got the underlying host condition that you have to deal with. And your various herbs, like your black walnut and chaparral and wormwood and cloves and all these garlic and other things, they're going to simply drive out parasites. They're not going to heal the body. If anything, they're going to suppress the vitality in the body. So I can't see the wisdom of using them on a long-term basis, but I agree entirely with Anita here that I don't think the short-term... I don't think it's a problem to do it a short term, a couple of weeks or a month or whatever. I think it would be quite good to drive out the parasites, but then have a recognition that you have to continue the job and bring the electrical potential back up in the tissues, bring the vitality back up in the body, in keeping with what we talked about yesterday with the pleomorphism. Get the body eventually into a state where it's too healthy to have parasites, and those herbs are not going to do that.
I would just like to say that I never used a parasite cleanse, and my radii solaris have gone. So I've just been on the program, the body electronics program. So you could do it that way too. I think it's slower, but it works.
But whether or not you use the parasite cleanse, you'd still have to do what Anita's done. You'd still have to get on the program to get the radii solaris to go away. Tom?
Speaking about the tens and the sonic things we're using like that, you're talking about getting the electrical impulses higher in the body. Is that where the Lakhovsky multi-wave oscillator comes in? Because I know that Nikola Tesla helped him on that, and it's supposed to do as far as cell rejuvenation, which makes the body too healthy that tuberculosis and cancer can't live in it. And I was wondering... I know that it's electrical, but the way it goes in, I've never heard of it being at a frequency that would cause tissue damage through all of the research that Tesla and Lakhovsky did. And I wonder if you have anything on that. Oh. So.
I've heard of them. I've never seen one. I've never seen one in use, so I don't really know much. I don't really know much about it. The only thing I have heard about it is that they pretty much use a broad spectrum of frequencies. Kind of a scattershot approach to, in the hopes that they'll get get pretty much everything. Whether it's harmful to the body in any way, I honestly have no idea. Sama? Bottom line, none of these gadgets change consciousness.
Yeah, sorry, I have to be a bit more specific. I think my question will go more to those lovely colonic hydrotherapists who are around. I've been wondering about mainly because of intestinal parasites. And I think I read somewhere the possibility that if you're colon cleansing and you're not careful, parasites. For example, if you have Ascaris, or what Ascaris lumbricoides, inside the colon, it can probably be pushed back into the small intestine. But remembering what Dr. Ray said here, I realized that except you are using the pressure system, you cannot push anything beyond the ileocecal valve from the colon into the small intestine. But now the question was, will it be advisable, for example, to do a simple stool parasite test before you go on to do a colon therapy for somebody you suspect has been living in the tropics or places like that?
That question was kind of directed to me. For starters, I have had some people who have had medical checkups in Europe, doing all the analysis. I mean, that is before you go to the tropics, you're given a proper checkup, stool specimens and all of those. And they've been given a clean board, you're all right, you don't have nothing. But I have had those on the table for colon irrigation, and they have passed Ascaris, actually. And also what I have noticed is that there have been students of body electronics who have been on the table as well, who have been on a high nutritional program, who have been on the program, and they have passed lots of parasites without having the parasite cleanse. So as a matter of fact, you get yourself tested for it, you might not have a positive result. And what I did not understand also was that I asked some lady to go to have her stool tested because she was bleeding, and they didn't mention anything about parasite. Anyway, they couldn't find any parasite. I don't know whether they couldn't find it, but they did not say anything about it, though I sent her for something else. So I don't know whether I was just, someone just kind of asked me a question, so I just answered the question plus the remark that I had.
From my experience, it's when you're working in the laboratory, you're dealing with, for example, you want to put something under a microscope. It's very difficult to take, if you have a bulk of stool brought to the laboratory, you can only use a very small, tiny amount. If you don't use that small, tiny, if you want to use the whole stool, then you have to go through a process of what they call concentration of that stool, because you want to use a large amount. And in most cases, laboratories wouldn't have the time to go through that concentration process. So I can actually see why somebody will still have the parasite, and then you end up with a laboratory results which says negative. Yeah. Yep. Absolutely true. It depends on the knowledge of those working in the laboratories too. Thank you.
4 or 5 years ago, I was at the Hippocrates Center in Florida for 4 weeks, and before you start, they take your blood, and you can see it on the computer. So cancer cells and all that, you can see that. Also parasites. So when I started, I didn't have parasites. After the cleanse of 3 weeks and with high wheatgrass and everything, they check it again, and then the parasites were there. So it's another thing too.
A person can be too healthy to have parasites, but it's also possible to be at a level where the vitality is low enough that the parasites are not there. So you can actually come up into the range where they're there. Or the other possibility, Janine, is there may have been some different type of microbe there initially that was not detected on the test, and then as the internal environment changes as a result of that program, that changes into something else that does show up in the test. So there's a lot of possibilities there.
I work with a naturopath in Hawaii who's done a lot of research into the stool testing and has found a lot of labs are just missing the mark. And he uses a particular one, having gone through many, And also, the latest information coming out is that there's a test called rectal swab, which is supposedly a lot more accurate than the actual stool test at determining parasite infestation of the colon.
What about using the Schweitzer for that? Using the Schweitzer for parasites?
I'm not aware of the Schweitzer actually driving out the parasites, but it would bring up the vitality in the tissues, which is what you want.
Yeah, and also good in the colon for any kind of scar tissue in the colon. The Schweitzer would be good, but not necessarily for driving parasites out and for boosting the immune system, but not specifically for pushing them out.
Of course, if you have the parasites, what do you always have? You have scar tissue. So the Schweitzer would be perfect in that sense, but not necessarily for getting rid of the Schweitzer. Why don't we get the next slide and the lights in the door and all that? Oh, we'll get Elaine first.
Still on my knees. Just 2 comments, really. I did try using the Zapper because a friend of mine's got one, and I did the Hulda Clark liver cleanse, and it was really quite effective in that I passed probably about 40 or 50 gallstones the next day. The other thing I was just going to comment on is when I had my amalgams taken out, I used a TENS on my upper jaw, and when I had the cranial done a couple of weeks later, all that electric was coming out again for ages.
Say that loud. Stand up loud right hear that. That's good.
Okay. When I had when I had my amalgams removed during the summer, I used a TENS machine on my upper jaws just to sort of numb the pain off a little bit. And when I had the cranial done about 2 weeks later, it took about an hour for the electricity. I could feel the throbbing actually coming out during the cranial.
Thank you. Yeah.
I did the Hulda Clark program probably about 6 months ago. When I had the colonic the other day, and I've never been told this, and I've had many colonics in that period, he told me I had some parasites. So, and I know he told some others as well. So he can tell if you're having a colonic with him.
The thing about it is you can drive the parasites out as many times as you want with the Neurable program. But bottom line is if you don't bring the vitality of the body up, they're always going to eventually reoccur. So the bottom line is here is let's get the vitality of the system up. Can we get the lights and the slides here? Okay, this would be a right eye here, and I believe that that's going to be an appendix right in that area, where there's probably been the appendix either removed or else it's in trouble there. You've got an overall kind of a tight autonomic nervous wreath. Let's hit the next one. Okay, here you can see the lymphatic rosary forming out around here. You all see that? And you notice you got quite a dark black scurf rim out here. And you'll notice that the lymphatic rosary is already starting to pull in towards the center. You know, it's further in than, say, zone 6 would show up on the eye chart, which is going to show that you've got a higher degree of lymphatic congestion here. You notice how it's pulled in a bit there. And it's getting to be a pretty good lymphatic rosary around there. Okay, next slide. Okay, again, a lot of the... you see these individual dots that make up the lymphatic rosary? These are called your tophi, which is spelled T-O-P-H-I. T-O-P-H-I. Those are the individual dots in the lymphatic rosary. That's just a surgery up there. That's a little bit of... that's not a black spot or anything. That's just a little bit of the iris that's been removed for some reason. It probably does have reflex activity to the body going the other direction. So, reflexes go both ways. So whatever part of the body is represented by that part of the iris has probably just been zapped a little bit by getting that little bit cut out. We have had a couple situations where people have seen something like that in somebody else's eye and thought it was a black pigment spot and gotten totally freaked out because they thought the person was about to die of cancer, only to find out that it's not really a black pigment spot. It's just that there's part of the iris that's been nipped out. Who was that? Oh, right. Tom has had an injury to his eye, an injury to the eye itself. So as a result, in fact, Jensen had the same thing happen to him. There's a little pigment spot in his eye that was a result of a thorn sticking into his eye at one time. So Tom has a little spot in his eye that, if you first looked at it, you'd think, oh, we got something going on here. But actually, it was an injury to the eye. Now, of course, since you have an injury to that area of the eye, it can then affect that same part of the body. For example, if you were walking down the road and you stepped on a nail and it went right up through your foot, like, say, through the kidney area of the foot, that's going to affect your kidney. So it will actually be something going on there, Tom. Okay, next slide. Okay, again, we've got quite a bit of a lymphatic rosary here. You'll notice also that the color's starting to get darker on the lymphatic rosary here. You're going to more of a rust color. But you all see it here? Okay, so we've got the lymphatic congestion. Notice how right in this area, you're starting to have it kind of form up into like a solid kind of collar right in here. It's not just dots anymore, but it's starting to like extend a little bit in this direction and in this direction. And that's going to be another sign that the lymphatic congestion is getting to be more severe. Next slide. Okay, again, you can see some lymphatic congestion right here. Okay, next one. Okay, again, you can see the lymphatic congestion right along and through here. All up through there. Notice the scurf rim is relatively thick and quite dark. By the way, in your eye slides, when you're trying to judge your eye photos or eye slides, when you're trying to judge the scurf rim, don't be thrown off by the flash here, because the iris is a curved surface, and so the side away from the flash, you're going to have a bit of a shadow effect here. So a lot of times you'll look over opposite the flash and you'll think you have a really, really thick black scurf rim, and in reality, a lot of times all you really have is a shadow there. So, when you really want to try to judge the scurf rim, try to look at the eye lit from, one side and then the other to get a more accurate, picture of what you're dealing with there. That won't be a problem when you're looking in somebody's eye, but with a photo it often is. Next slide. Okay, again, we've got a lot of the lymphatic congestion here. Now, notice this this band right here. That's known as a trabeculae. T-R-A-V. Thank you, Anita. T-R-A-V-E-C-T-U-L-I, trabeculae, E-C-T-U-L-I. And that's basically kind of like a continuous band of mucoprotein that's going from zone 6 in towards zone 3. And that's going to indicate a fairly severe engorgement of the lymphatic system. Now, I want to just mention something here very, very briefly. One of the things that you can do that will be very, very helpful... Why don't we get the lights on for just a moment? One of the things that you can do that, of course, will be very, very beneficial for your lymphatic system is going to be the mini trampoline or rebounder or lymphocyzer that a lot of you are familiar with. And we recommend that very, very strongly for people. We recommend for most of you that you start off fairly slowly, maybe 30 seconds at a time, and build up to about 5 minutes 3 times a day of light bouncing. But I do want to mention that I know when we came to Australia about a year ago, there were some fairly ridiculous notions going on around about lymphocyzers, and I just want to make sure there isn't anybody buying into any of these things anymore. Jumping on a rebounder does not manufacture enzymes. There were people that believed that last year in the class. Jumping on a rebounder does not manufacture minerals. And if you remember John's drawing there in the overhead, you remember you had that little lymphatic vessel that would be where the waste would be removed out of the interstitial fluid? And you remember how the mucoprotein was far too big to fit in that lymphatic vessel? No amount of rebounding is going to make that piece of mucoprotein fit inside that lymphatic vessel. No matter how much you bounce around, a basketball doesn't fit inside a garden hose. Okay? So just bear that in mind here, because a lot of people take the position that you can jump on a rebounder and get rid of your mucoprotein, and it's simply not so. You can't bounce the stuff to bits. It's going to take enzyme activity to break down the little linkages between the amino acids and the carbohydrates and basically convert the mucoprotein mass down into a smaller size molecule that can then be removed out through the lymphatic vessels. Now, it may be possible that there may be some other way to do this. For all I know, they'll come up with some sort of energy machine that can make the mucoprotein break up. But I'm not aware of anything like that yet. And definitely as far as I know, the lymphosizer or the rebounder is not going to actually dissolve or in any way break up the mucoprotein. What it is going to do, which is very beneficial, is it's going to move the lymph. It's going to move that fluid. It's going to move the fluid in and out of the cells more rapidly to get things cleaned and so forth. So it's very, very helpful, and we recommend it very, very highly. By the way, Lewis uses the rebounder, and it's been very, very helpful for Lewis, where he'll put his feet on the rebounder, and he'll have somebody else jump on the rebounder for him. And when I was over at Lewis and Chris's house in San Diego, Lewis informed me that was part of his employee health care program. Okay, if we could get the lights and the next slide here. Oh, Anita? Okay. Lewis is always thinking out for the people that work for him, so he's really not doing it for himself. He just wants to make sure their lymphatic system is in good shape. Right. Okay, if we could get those lights down as well. A little bit. Okay, again, we've got a pretty good lymphatic rosary here. I might add, by the way, as I mentioned earlier, that the lymphatic congestion is frequently associated with a problem with the thyroid gland. So one of the things you always want to check is the thyroid. And if you notice here, you've got a right eye, and you've got this pigment spot that's going to be right about in the area of the thyroid, right here. So you're going to need to work on the thyroid as well, for sure, on this individual. Okay, that's it on that one. Why don't we hit the next slide? What number is this, Matthew? Oh, that's just a surgery there. You've got like some sort of implant there. You can see the little screws there. And this thing's been stuck on. But you've also got the lymphatic congestion there. You all see that? Number 20. Thank you very much. Okay, why don't we hit the next one there? Okay, here we've got again, a lot of mucoprotein buildup. And notice how the lymphatic rosary has moved in. So you've got a fairly thick scirphrem. You all see that? Okay, next slide. Okay, if you look at this eye here, you've got a couple of interesting things. You see this growth, this kind of white growth with all the blood vessels in it. I believe that's coming out from the inside. I think this is a left eye here. You have two different situations. For some reason, they have different names for it, depending on whether it's coming from the inside of the eye or the outside of the eye. But you have a growth that's known as a pterygium, which is P-T-E-R-Y-G-I-U-M. Thank you, Brooke. Pterygium. And then you've also got the P-T-E-R-Y-G-I-U-M. And then you've also got a Pickawillium, which is at any rate, it's a pterygium when it comes from the nose out, and when it comes in from the side, it's known as a pterygium. But in either case, it's a growth over the eye. The Pickawillium's P-I-C-C-A William, and don't ask me why they have a different name for it, depending on which direction it comes from. They just do. It seems to it's often observed in people. It seems to have something to do with irritation to the eye, because you see it a lot in like windsurfers and people that are out on the water a lot, or around a lot of sand or dust or various things of that nature. In most cases, what will happen is it'll get to a certain point, and then people will just have surgery to lop it off, because of course if they let it grow enough, it's going to cover the pupil and you won't be able to see. On the program, it's often pretty simple to get it to pull back and gradually dissolve. And one thing that works very well for that is the eye wash, which you've got there in your program sheet, which is a herbal formulation where you can add a little bit. You can add some minerals to it, and you get one of those eye cups and wash your eyes out a few times a day. And by the way, if you ever do the eye wash, you'll find that it's very, very common that you'll drain all sorts of pus and junk out of your eyes. So a lot of people, if they do it, say they do it before they go to bed, it's a very good idea to leave like a damp cloth next to the bed, because you might wake up in the morning with your eyes totally gummed shut, because so much stuff's oozed out overnight, and then as it dries, your eyes are pretty well stuck shut. The other thing that we have in this eye is what they call a sodium ring or a cholesterol ring or a mineral ring, which is this opaque white ring that you see around the iris. This is typically going to be found out in zone 6 and zone 7. It's in front of the iris. So the sodium ring is actually going to obscure your zone 6 and your zone 7. And it's called a sodium ring because it was first observed in salt miners. But it doesn't necessarily have anything to do with sodium. It's frequently associated with the deposit in the body of inorganic minerals. I've seen it in a lot of people that drink what you call your well water or your bore water, where oftentimes if that water is very, very hard with a lot of inorganic minerals in it, you'll often find a good sodium ring. It also is associated with cholesterol and hardening of the arteries and plaque buildup. So you'll see a lot of situations where people have this type of formation. They'll have a lot of problems with the arteries and that sort of thing. Why don't we get the next one here, Matthew? Oh, Esther?
This looks like an interesting eye. For starters, what color of eye is this? And can you just talk about this, the zone 1, 2, and 3, and the whole works? Because
I believe this photo has been taken with some sort of color filter because everything really looks quite blue there. So I don't think that really is. I think it's pretty difficult to discuss just what color it is because it's pretty hard to tell. I think there's some sort of filter on that. Okay. Why don't we'll get the next one here. Okay, again, you've got a sodium ring right here. You all see that? It's an opaque. Let's get that. Mineral. The terms are used synonymously. Sodium ring, cholesterol ring, and mineral ring. It's an opaque white ring that will be out in the periphery there. You can oftentimes see people where it's starting to form, but it's not that dark yet, so you can actually see through it. So in some cases, it's not fully formed, it's not opaque. You can actually see the fibers underneath it, but once it gets to a certain point, it does obscure zone 6 and zone 7 because it is actually out in front of them. You're definitely going to have to get on a good heavy program to take care of something like that because you're going to have to pull all those minerals back out of the system. Come on up, Ruth.
Is that also the called the arc of senility, or is that something?
No, the arc of senilis is totally different, and we'll get to that. That's where the sclera is pulling down over the iris, and we've got some slides of that later on. Sama?
Okay, anyway, I've been a bit interested in cholesterol rings, and what I've been doing is...
Yeah. Let me get the lights for this. Thank you, Dana.
On a few occasions, with Africans who've got very big sodium ring, I've been pushed to take them privately into the laboratory and do a cholesterol triglyceride test on them. But on the 4 occasions I've done that, none of them have ever had any cholesterol level above what you would call, in quotes, normal range. So it's been worrying me a bit, and I'd like Doc to talk about it.
The blood cholesterol test is going to measure the amount of cholesterol in the blood. Now that sounds kind of obvious, but consider this: when you have the cholesterol and plaque build up in the arteries, it's in the walls of the artery. It's inside the walls of the artery. So you could have a person whose arteries are really quite blocked, and yet they might have a relatively low blood cholesterol level. You might have another person whose arteries are relatively open, and they might have a very, very high blood cholesterol reading. So I'm not so sure that the reading has all that much significance. You take a person and put them on a huge amount of lecithin and lipase, which is going to start to break up the cholesterol. Their readings might go through the roof temporarily. So I think there's a lot of other factors that could be involved there, and I wouldn't necessarily get overly concerned with the actual numbers on the test there. I would really go more by what I saw in the eyes there and in the sclera, which we'll get to in a bit. Question? Come on up.
I was just interested to know whether the lipase handles both cholesterol and plaque, or just the plaque only.
Okay, the cholesterol is a fatty-based substance, and in order to pull the cholesterol out, to work on that, you need your lecithin, which is going to emulsify it or break it down into smaller particles. You need your lipase, which is an enzyme that works on the surface of fats, which means that it can only hit the surface. So the lecithin, by breaking the fat molecule down initially, makes the lipase more effective because it's got more surface area to operate on. The flax oil will play a big role in also doing this, because one of the things that you have is cholesterol on its own has a melting point that's way above body temperature. But if you have cholesterol in conjunction with your lecithin and your omega-6, which is one of your essential fatty acids, its melting point actually goes down below body temperature, which means that the cholesterol is going to be liquid at body temperature, as opposed to being this hard gray wax, which it often is as a result of the deficiencies of lecithin and omega-6. The plaque is primarily composed of different types of minerals and heavy metals and that sort of thing. So the lecithin and lipase are not going to have much of an effect on that. That's going to take minerals and enzymes to pull that out of the system. And another thing that will be very, very effective is your niacin, because that's going to help to dilate the various capillaries and to help to get the nutrients out there. What Anita and John have used at the Cook Islands is you've got the lecithin, the flax oil, the lipase, the niacin, the minerals, the enzymes. That's the oral chelation program pretty much, isn't it? And thank you. And the high fiber diet. And when you have all of that together, that's going to pretty well pull things out and clean out the arteries. And then you'll start to see changes in the blood pressure and all sorts of things that will take place there. Okay. Why don't we get the next slide there? Okay. We've got ourselves a heavy dark black scurf rim. And since we have kind of a nice slide of it, I would like to point out, you see these lesions right in this area? You're very definitely going to want to work on the heart in this individual. This will be a right eye. Now, where is the heart found in the Jensen chart? Okay, it's found in the left eye over around maybe 215 to 315. It's found in this area in a left eye. Your heart, while it's predominantly on the left side of the body, it is actually partially on the right in most cases, and it is going to be found very definitely in the right eye as well as the left eye. Mirror image, meaning you take your Jensen chart and you put your heart over between about 8:45 to 9:45 in the right eye. About 8:45 to 9:45 in the right eye. So you look at these lesions right there, and that's quite definitely going to be the heart right there. Simon.
How do you know that is not in the lung area? And how do you know it's the heart area?
Okay, with respect to the lungs, if you look very carefully at your eye chart, the lungs are not found in zone 3. They're out in zones 4 and 5. They're not right next to the autonomic nerve wreath. Now, the bronchioles are right next to the autonomic nerve wreath. So it is possible in some cases when you're dealing with a lesion over in that area that you may be dealing with bronchioles. This particular type of pattern here, where you've kind of got this cluster of lesions all in that area, that will pretty much always be the heart. That'll pretty much always be the heart that you're dealing with. So that's something that you very definitely want to work on. Now, when you look at a lesion in the eye, one of the things that you want to look at is the fiber color within the lesion. And what do you notice right there? I mean, look at the color right there compared to a lot of the rest of the eye. It's definitely on the dark side in there. The lesion is going to indicate what? What does a closed lesion indicate in the iris of the eye? Okay, it indicates an inherited weakness. Okay? If you have an inherited weakness, say in the heart, does that mean that you already have a problem in the heart? You have a tendency towards a problem, and your heart's certainly not perfect, but it may be functioning more or less okay. So what you need to look at is not just whether there's a lesion there, but what's happening within the lesion. And if you see a lesion like, for example, this one right here that's very, very black, see how there's really very little presence of fibers inside that lesion? That type of black lesion like that is going to indicate a much more serious problem than a lesion that would be all filled up with fibers. And in particular in the heart area where you see a black lesion that is roughly diamond-shaped, what is that going to indicate? Heart firing mechanism. What do we need to do?
When you get somebody in this situation, when you look in their eyes and you see a black diamond in the heart area, either in the right or the left eye, what you got to do is pretty much hold their point straight away. You've got to act on it fairly quickly, especially when you start looking at the sclerology side of it. When you've got that scleral line coming in and almost touching or very, very close to the edge of the limbus or edge of the iris. That combination, you've virtually got to act on it very, very quickly. Because what John says is they've either just had a heart attack, or they're just about to, or they're just going through one right then and there in front of you. I think Well, they're looking for a place to have one, and invariably it might just be in your practice that they want to have that heart attack. So you've got to be really, you've got to look out for that, and that's a good one. Okay, it's sort of like a diamond shape, and it's going to be the heart firing mechanism, which you all know the points on that. So when you're looking at your patients and the people that you're seeing, when you see that sort of thing, you got to go down and mark that on the list, but pay very, very close attention to the scleral lines that are there in the eye as well, because quite often you might have to just lay them down there right then and there.
Thank you. Next slide. Okay, again, we've got a fairly heavy scirphragm out in that area. Next slide. Okay, again, we've got a fairly heavy scirphragm out here, you all see? Okay, next slide. Okay, again, you see the heavy scirphragm all out here? Okay, next slide. Okay, again, a good black scirphragm. As John says, you won't see too many dark black scirphragms anymore, but these are some good ones from the old days. Sure.
Just something on that, because when you're looking at an eye, like from a distance, as I often do, you can quite often, you think you're seeing like a really, really dark scirphragm, but then if you've noticed, if you've got your photos taken, you look on your photos and it doesn't look as dark. So just bear in mind, when you see a photo or a slide in this case where it looks really, really dark, just imagine it's probably going to look a lot darker looking at it in a naked eye. Because would that be right? I've noticed that quite a lot.
It'll vary with the camera too. Okay, next slide. Okay, again, we've got a nice dark scirphragm here. This will be a right eye. So again, we're going to look at that little lesion out in the heart area right there. You all see that? Everybody see what I... Okay. Next slide. Okay, again, a nice dark scirphragm there. All the way around. You all see it? You notice the lymphatic rosary in there as well? Okay, next slide. And again, a fairly dark scirphragm there. Can we have the lights for a minute here? Okay, if we want to talk about the scirphragm and zone 7, remember we're dealing with two things. What would they be? Yes, the cellular level of the body and the skin. So we want to look at just a few factors that will create a scirphragm. And you've got a number of things to consider here. It may relate to the skin. So you have to look at things like, for example, has the person had a lot of skin conditions that have been suppressed? A lot of people have taken all sorts of acne medication and all sorts of cortisone creams and all sorts of other things that have suppressed situations in the skin. If this is the case, this can often lead to a very, very heavy scurf rim. Now, what might that individual expect in healing crisis? All sorts of fun. They'll be a teenager all over again. They'll be breaking out all over and oozing all sorts of things. So you can have a real good healing crisis on the skin. Anything unnatural that you put on the skin is going to suppress the elimination through the skin. So one of the things that you're looking at here is going to be all your sunscreens, or most of them, where they're your basic petrochemical derivatives. So most of your sunblocks and sunscreens and your chemical type skin moisturizers and all the rest, your cosmetics. These are all things that are, what's that? Soap. Yes, soap can have an impact on the skin. But basically all of these types of things that people are using on the skin are going to have quite an impact. The saunas and sweat lodges, if they've been done at excessive temperature, that will have a suppressive effect on the skin, and you'll often see quite a heavy scurf rim there. And one of the things, John mentioned a story one time. He said for some reason he was doing a bunch of eye readings in a nunnery, where there were a bunch of these nuns that had like these, they wore these real full-length habits, so that like basically the sun never touched their skin. They had the full hood and everything, and maybe got a little bit of sun on the back of the hands. That was about it. And as a result of that heavy clothing all the time, where there's very little exposure of the skin to the beneficial effects of the air and the sunshine, he said it was some of the worst scurf rims he'd ever seen in his life. So one of the effects that you'll have, and you'll see this in a lot of your extreme latitudes far away from the equator, where people spend a lot of the year dressed in very, very heavy clothing. The skin needs exposure not just to the air but to the sun. You need exposure on a fairly regular basis, so you're going to need that. And if you don't have it, you'll often get the heavy scurf rims. Of course, if you go in the other direction, what's going to be the effect of somebody that's consistently getting sunburns and damaging the skin that way? You're also going to get the very heavy scurf rims. Brooke? Alrighty.
I just want to say, with regard to cosmetics, if you can't eat it, don't put it on the skin. And that keeps it really simple. And just use natural things you find in your own kitchen to help your skin, not all these pre-prepared potions that they have. Because even the really, really natural ones, if you read the ingredients, you'll find that there's chemicals in it, and it's going to go in, and then you're going to have to get it back out again. So the best thing to just remember, if you can't eat it, don't put it on the skin. And also, I want to caution women, and also some men, about some men in this class, about hair dyes. Because a lot of the hair dyes have very harmful chemicals and perms, and they just go right through the brain. Because the skin is porous, and all these chemicals will go right through. So be careful with the kind of hair dyes you're using. Also, costume jewelry, which I have on. But some of the costume jewelry are made with silver, mercury type materials, which disturb the immune system. Costume jewelry, I'm not talking about gold jewelry or silver jewelry. Not sterling silver, I'm not talking about sterling silver or gold. Okay, junk jewelry. Yes, in the little catches on the earrings. Yeah. So it's good to get like a sterling silver pair of inserts for your earrings, or gold, or stainless steel. Yeah.
Anita, could you suggest some natural things to, you said from the kitchen, to put on your skin?
You can? Yeah. Okay, Brooke.
Tom will like this. For your face, things like dicing up cucumbers. A lot of the ladies out here are probably pretty keen on all this sort of thing. Avocado skins, getting the oils, things like that. You know, natural vegetables. What I find best is for just the overall body. I'll tell you my little tantalizing tricks. Keep praying, Ian. Keep praying. What I find best though is basically to use nothing in the shower. I mean, most people, like where I come from in Auckland, everything's it's fluoridated area. So, number one, I some of you may not like this. I try and shower as little as possible because I just don't like getting under the water, and even even sometimes what I'll do is I'll just use Schweitzer and just spray it over my body and just rub it off with a towel. I mean that's good stuff to get you clean. Or I'll have a shower or bath and then afterwards, after I've dried off, I'll spray Schweitzer on my body again. If for nothing else, it's good for the skin, but even more so just to give the immune system get it kick-started again. But, I mean, a lot of the vegetables like your cucumbers and these sort of things are really good for your skin. I'm not taking a lot of it at the moment, no, but I have been known to drink. It'll get if you drink it internally, it'll get out to the cellular level pretty quick. I think it's something like 30 seconds. It's pretty well much out there already. I mean, if you drink enough of it, for those of you who have been known to drink a lot, you can feel it getting out there, right, Jim? But externally, it's really good as well. I find.
I had a lady with very, very, very dry skin, and she just started taking the flax oil, just drinking it, and her skin just immediately, the dryness just left, like I'd say within about 3 weeks. 3 weeks, and she had perfectly oily, natural skin. Simon, you want to say something on that?
Yeah. There's a very good book written by Udo Erasmus, who's a Canadian, called Fats That Kill, Fats That Heal, or Fats That Heal, Fats That Kill. I've got a copy of it. If you're keen enough, I could let you have a look at it. And if you follow any of he's got a lot of stuff in that book which pertains to good health in the skin. He's a bit of an expert. It's a very, very good book.
Get the book. Bottom line. Bottom line with the skin, as well as the cellular level, you're going to want to do a couple of things here. You're going to want to stay away from soap as much as possible on the skin. You're going to want to avoid all of Nikki. You need the naturally occurring oils on the skin because it's the interaction of the sunlight with the naturally occurring oils on the skin. This is how your body forms your vitamin D3. So if you're washing all the oils off your skin on a continual basis, you're out of luck there. And the D3 is necessary in conjunction with the parathyroid to regulate calcium assimilation within the body. So you really need that. You need to have the oils on the skin. You will want to avoid, obviously, all the sunblocks and cosmetics and all these other things we've talked about. And you also want to try to stay away from very hot and very cold showers. But most people aren't going to take a shower that would be too so cold that it would hurt them. But you'd want to definitely stay away from the very, very hot showers. You'll see some people, for example, that get up, say, first thing in the morning and get into a scalding hot shower where they'll run it on their back for 10 or 15 minutes to wake up. And you look into that person's eye, and they'll have a very, very dark scurf rim, particularly in the back area, which is kind of down in the center of either iris. So you want to stay away from the hot and cold showers. The other thing that the other couple of things I should mention that can contribute to a very heavy scurf rim will be anything that locks a lot of unconsciousness in the body, which would include anesthesia, medications, recreational drugs. Firewalking would be a very, very good example of that, alcohol, and also periods of unconsciousness. You have people that have had accidents and have gone into comas and states of unconsciousness for long periods of time, and they'll often have very, very dark scurf rims. Do you need me to hit that list again? Alcohol, drugs, medications, firewalking, anesthesia, comas and states of unconsciousness. Electric shock would probably be another thing in that category, because that's going to put a lot of unconsciousness into the body. So as far as what you do about it, the main couple of things that you want to do, besides staying away from the scalding hot showers and the soap, is do lots of niacin flushes, because this is going to be very healing not just to the skin but to the body at a cellular level, and use the Schweitzer fluid on the skin in particular. Flax oil, as Anita has suggested, is also absolutely tremendous for the skin, just drinking the flax oil. Rebecca?
I might have actually missed this, but what's the problem with the firewalking?
You must have missed it, because I think we covered it last week probably for a fair bit, but the firewalking is an experience that has a tremendous impact upon the person's emotional body, because you're basically suppressing everything within the emotional body. It's an experience where you're walking across hot coals and you're not really feeling what's going on there. And if you think about it from a reflexology concept, you have on the bottoms of the feet, you have reflex points to pretty much everything in the entire body. So it's basically locking in a tremendous amount of unconsciousness and everything else in the entire body. And we've seen a lot of people before and after their firewalking where it's obviously made the scurf rim quite a bit darker and quite a bit thicker than it had been previously. And if you go back, you'll find in a lot of your sorcery practices, the firewalk is a pretty typical rite of passage to get into that field, shall we say. And also, if you go back scripturally into the Old Testament, I read through this one time, and I found, I think, around at least 24 or 25 separate references to firewalking, none of them positive, and all pretty much saying, do not allow your children to pass through the fire. I mean, over and over and over again throughout the Old Testament, you'll find a condemnation of the firewalking, and it literally says within there that if you allow yourself or your children to pass through the fire, that it cuts you off from the presence of God. So this is something that people want to be very careful with. Now, obviously, there's a number of people here that have done this, and as we mentioned last week, but I'll repeat it again because there may be a few other people that perhaps were out of the room at this time, it is possible through consistent application of body electronics to undo the adverse effect of the firewalk. It is difficult, and only a few people to our knowledge have done it. But we have had a couple of people that have done a very, very good job of re-experiencing the burning in their feet and perhaps other parts of the body if they were doing cartwheels or anything. But there are people that have been able to go back through the firewalk and shall we say, overcome the hold that it's had on them. And my recommendation here is pretty simple to all of you. If you've never done it, don't do it. If you've already done it, don't do it again. And if you already have done it, don't get upset. Just acknowledge that you've made a mistake. Like all of us have made mistakes in many, many other areas. None of us are here throwing stones at anybody. There's probably very, very few people here in the room that haven't done something they regret. There's probably very few people here in the room that haven't gotten drunk or done some drugs or done something else equally silly. Well, besides Tom. So the bottom line here is count it a blessing. Count it a blessing that you've had that experience for now, and recognize that if you can go back and overcome that experience, you have the potential to be a very, very effective teacher in this area. And you actually have the potential to be much more effective in this area than somebody who hasn't done the firewalk. Because a person who hasn't done the firewalk, there's always going to be an attitude amongst certain individuals that, well, what does that person know? He's never done it. So, the point I'm making is if you can say, look, I did it, this is how it affected me, and now I've been able to go back through it and so forth, that's a little tough to argue with. So, just like I said, count it a blessing if you've already had the experience, and let's, get on with it and overcome it. Mag? Well, as we had in that diagram up there earlier with the lower, middle, and higher self, what you're essentially doing with the firewalk is you are allowing what's getting you through the fire. In the case of a firewalk, That's not your higher self that's doing the work. It's not the presence of God that's doing the work. You're basically tying yourself into the collective unconscious. You're tying yourself into the collective unconsciousness at the level of the lower self, and that's what allows you to pass through the fire. There's been many, many people that we know of that have gone through this experience who have described the experience as basically like they were being taken over by something else, like there was this external force or power that took over and basically allowed them to go through it. Now, not everybody's aware of this. Not everybody notices this as it's happening. But this is basically what's happening. And so as we had in that diagram earlier today, the attention is now locked or fixated onto the lower self, which in effect cuts the person off from the higher self, which is why scripturally it says you'll be cut off from God. I mean, if you're cut off from God, you're cut off from your own higher self. You're cut off from your own God presence. That's not permanent. It can be overcome, but it takes a lot of discipline and effort to do it.
At these ceremonies, there's usually a period of ceremony before the actual fire walk where they're actually evoking these dark forces to come and actually possess these people to go over this fire.
Bear this in mind. For every truth, there is a counterfeit for truth. For every truth, there is a counterfeit for truth. Fire is one of your primal energies, one of your primal elements. The truth, the fire that will really uplift you, is the fire that comes from the inside out, the fire of the Kundalini, which is what you get up at the level of pain, the painful level of pain in the emotional body. This is a purifying force on the emotional body. This is what burns off the resistance on the emotional body. That type of fire, the fire of the Kundalini that arises from within as a result of obedience to higher law, this is the fire that is the truth. For that truth you have the counterfeit, which will be the fire walk. Bear this in mind. You do not have to prove yourself to anyone. This is often the pattern that's there. We had one individual who went through this a number of years ago, where she recognized, both in a past life memory as well as in the present, that there was the pattern of, I have to pass through the fire to prove myself to God. Total nonsense. You do not have to prove yourself in that manner. Now, if you look back scripturally, you'll have 3 individuals that were thrown into the fire against their will. You know, Shadrach, Meshach, and Abednego, or whatever their names were. Totally different situation, because they did not choose to go through the fire. They were saved by their faith. There was an element of grace there where they were saved from being burned to death. But bear in mind that you have a totally different situation there, because they didn't choose to go in the fire. They basically clung fast to their faith in God, and as a result of that, they were thrown into the fire against their will. And as a result of their steadfast faith, they were spared the negative impact of the fire. That's a totally different circumstance. Nobody is forcing anybody in this day and age to pass through the fire. It's a choice that people make, and like all choices, we bear the consequences of it. Any more on that one, Rebecca? Okay, one last thing on it. On a genetic level, there's probably very few of us that don't have fire walking in our genes anyways. I mean, if you want to go back historically, there's probably very few of us that haven't on a soul level or on a genetic level been across the coals once or twice, because this is a practice that is as old as the ages.
Not referring to fire walk, but what's wrong with silk? I think it's one of the rare natural products.
What's wrong with what?
With silk.
Did I say something was wrong with silk?
Stay away.
What do you do with it? I'm missing the question. What's wrong with silk?
You said stay away from silk, and then...
Soap.
Thank you.
No, thank you. Next to your skin, you should really, it's ideal if all your clothing can be natural fibers, things like silk, cotton, linen, wool, these types of things. Leather would qualify for some. But this is particularly important next to the skin. You have a situation where the most of the pollutants that are being eliminated out through the skin. Now listen up, people. This is important. Most of the pollutants that are being eliminated from the skin will have a positive charge. This is the principle of using a negative ionizer in your home. Your natural fibers will have a negative charge, which means they're going to tend to attract the pollutants that are being eliminated, the toxins that are being eliminated from your skin. Natural fibers will do this. So when you wear cotton or silk or linen next to your skin, the toxins are being pulled away from your skin because they're basically adhering to the clothing, which is also why it's important to wash your clothing on a regular basis and change it, because you're basically carrying the toxins around with you. No, I wasn't looking at anybody in particular. I'm just saying in general. I mean, we're in the tropics here right now, folks. You're really not going to get more than 1 day out of a shirt, and probably half the time here you'd be better off to go half a day on your shirt, because basically if you're sweating a lot and eliminating toxins, they're there in the clothing. If you wear a synthetic fiber, that synthetic fiber like your nylon and rayon and that sort of thing, it has a positive charge like the toxins, so it repels the toxins. They don't cling to the fiber, so where do they remain? On your skin. So this is one of the reasons why you need to get the natural fibers next to the skin. And by the way, this is one of the principles of juicing, where they say that if you get a pulp-free juice, all the toxins adhere to the fiber. You know, you make a juice where you've gotten rid of all the fiber. It's the exact same principle there. One last thing I'll get you here, Matthew. You do have a double-edged sword here, though. How many of you are aware that when you're dealing with cotton, that something on the order of about 25% of the pesticides in the world are used on cotton? How many are aware of that? So we've got a serious problem there with the cotton, unless you're able to get the organic cotton, because you have a tremendous amount of pesticide residue that you're putting right on your body. And that, by the way, doesn't even get into all the other chemicals that are used in clothing. Never wear a piece of new clothing without washing it at least once or twice, because you're getting all sorts of chemicals directly onto the body. I found, by the way, that with a new piece of clothing, where on a couple of occasions in the last couple of years, I've tried to wear something, and I couldn't do it. I'd had to take it off in about 10 minutes because I was crawling out of my skin. It was just, you could feel the chemicals there.
Could you comment about the soap residue in your laundry after you wash it?
In what way?
I notice typically you put your laundry through the washer with even a natural laundry soap. If you take that out and rinse it by hand, you'll get suds out.
Yeah, you're using too much. You have to use just the amount they say on the box to get, or less. Or even half. Right. Go way down on it.
I mean, who would think the soap manufacturers would try to get you to use too much? Is that why we have to shampoo twice?
I've started using these ceramic laundry discs. I don't know how many people are aware of those. And you can use a fraction, like an eighth of amount, or sometimes no soap at all, and they gets the clothes clean. Are you aware of these, Doug? Okay.
Simon, and then we're going to get a few more slides before dinner here.
Yeah, just one more thing on that. If we use a couple of tablespoons of washing soda and a couple of tablespoons of borax in a large wash, you'll have no residue and clean clothes.
Thank you. If we could get the lights and the slide, we'll hit a few more here before dinner. Okay, next one. The door and the lights, thank you. Okay, again, we've got a fairly dark scurf rim here that I think you can all see. And we've got a good bit of the lymphatic rosary here, the mucoprotein buildup in zone 6. Why don't we hit the next one here? Okay, what have we got right out here? We've got a bit of a sodium ring forming. And if you look right in this area, what's the overall fiber level that you're looking at? Very, very black, very definitely, without question, a level 7I here. If you just look right in here where it's all that black, you can't tell what fiber level you have out here because you can't even see it, because where's the sodium ring? It's in front of the iris, so you really can't see zone 6 or zone 7. But in this particular case, it's quite obvious that you're dealing with a level 7 because you see how black the fibers are in that area. Okay, next slide. If you have a question when we got the lights out here, I may not see your hand, so give a shout if we go on too fast for you here. I'm trying to look around, but I can't quite see everybody all the way to the back there. Again, another sodium ring right here. Okay, next slide. Remember, the sodium ring is synonymous with a mineral or cholesterol ring. We got another one right here. Okay, next slide. Another one right there. Next slide. Okay, another one. Next slide. And another one there. Okay, all the way around there. Now, you see this kind of yellowish, fatty-looking stuff here in the sclera? That's going to be cholesterol buildup. When you see some people will just have kind of yellowish tinge in certain parts of their sclera. Other people, it'll really look like they got like gobs of chicken fat in there. And this is going to be an indication of cholesterol buildup. You like that one? Yes, thank you, Donna. If you look up here, you see the sodium ring right here? If you look right up here, this is approximately the edge of the iris, right where I got the tip here. And you have the sclera pulled down over the iris as well as over the sodium ring, I might add. And this thing where you've got the sclera pulled down over the iris, that's known as your arcus senilis. A-R-C-U-S, arcus, A-R-C-U-S, senilis, S-E-N-I-L-U-S. It's literally just arc of senility. Arcus senilis, A-R-C-U-S, S-E-N-I-L-U-S. And it's the sclera pulling over the iris. It can occur 360 degrees around, but it's typically most pronounced in the upper extremities, meaning the head and the brain, which would be the top of the iris. And it's typically next most pronounced in the lower extremities, meaning primarily the legs, which if you think about the circulatory system, it would make a lot of sense. See, the arcus senilis is going to show that you've got pores, like if you see it up in the brain area very heavily, it's going to show a poor supply of blood and nutrients and oxygen up to the brain. Now, why would it be difficult to get nutrients up to the brain? Well, basically, you got to go uphill from the heart, so that's going to make it a little bit more tough. Plus, the brain uses a disproportionate amount of nutrients. It's metabolically pretty active. Why would you have problems with the circulation down in the legs? It's the return flow back from the legs up to the heart. So one thing that you can do that will help to some extent with this is what you call a slant board. Do you all know what a slant board is? You can make one yourself with an ironing board or a piece of wood or whatever, but you just basically get your feet up and your head down. Some people will just elevate the feet maybe a few inches. Other people will elevate it like, put one end up on a chair, that sort of thing. Of course, some people will go with the gravity boots, but, basically you're working with gravity to help get the blood flow to the head and the blood flow back away from the legs. There's many other factors. As Anita suggested earlier, what if you got all sorts of chronic neck problems? If the neck's out all the time, that's going to be a major factor in not getting the blood flow up to the head. We've had a lot of people here. Dana, for example. Where's Dana? Dana this morning was having a fever, and we're kind of going through a bit of a healing crisis. Now, what happened there, Dana? You want to come up and describe that?
Yeah, I definitely been feeling like I've been going through a healing crisis, and been running a temperature, pretty high temperature, and felt better in the morning. But then once I was eating breakfast, I was starting to feel hot again. And Doug came by and asked me if I was feeling any pain in the upper neck area, cervical area, and I definitely was. So he did an alignment, and immediately my forehead just went cool. I mean, it was almost like I could feel the coolness just, escaping. So it was immediate decrease in the temperature. It was pretty incredible.
And it got that, what was particularly important for Dana, she got that clunk way up way up top there where we got that top couple of cervicals in, or cervicals in, as they say here. So now it isn't always going to break a fever, and it isn't always going to put things back here. Sometimes it's just going to throw you further into healing crisis, getting a good adjustment. We might have a good example of that up here. But the thing about it is that whatever's happening, whether it makes your symptoms get better or worse, whatever you have to get through, if you can get the vertebrae in, it's going to be quite a good thing for you. This is something that we'll be getting into in the 5th and 6th weeks, where we're going to try to get you all acquainted with this, so you can start to get each other in there in the neck and back. And this is a very, very useful skill for all of you to have, not just for yourselves and each other, but for the people that you're going to work with when you get back home. And sometimes that can make a huge difference. Just something that only takes a matter of a couple of seconds to get the neck and the back in. Okay, let's just get a couple of more slides here, Matthew. Thank you, Dana. And we've got again another sodium ring that is covered up by the arcus senilis here. You all see how the sodium ring is you can see the edge of the sodium ring, but the arcus senilis is pulled, the sclera, or white of the eye, is pulled down over the iris, and it's covering up the iris as well as the arcus senilis there. Excuse me, as well as the sodium ring. Next slide. Okay, you see the really just the very beginning of a sodium ring there. You can see that kind of haziness out here, and yet you can still see the iris fibers underneath that. So that's kind of like an early stage of a sodium or mineral ring.
Sometimes when you're looking at the person's eye, you won't be able to see the sodium ring when you're looking forward at the person, and you have to kind of go on the side of them with the torch, coming in like at this angle here to see the sodium ring on the person. Sometimes you won't see it looking directly on straight at them.
That's what Anita's pointing out here is very, very important. When you're trying to discover what's going on inside the iris, you have to be very, very careful to vary the angle of the light source. Play around with it. Look at, most people are either, left-handed or right-handed, so they have a tendency to always hold the torch in the same hand and the loop in the same hand. And you really got to work at looking at it from both directions and changing hands with the torch and with the loop, so that you can get a good look at the iris lit from a number of different directions, and vary the angle of the light, and also the angle of the loop, so you can really start to see the depth of things there. It's not going to work if you just go straight flat at it all the time. Okay, next slide. Okay, again, another sodium ring right here that I think you can all see. Okay, next slide. Okay, another sodium ring right there. And again, you got the arcus senilis pulling down quite obviously across the top there. Next slide. Okay, another sodium ring right here. Next slide. Okay, you got a good arcus senilis right up here. You see that's the edge of the iris right there, and the sclera is overlapping down to about there. And you'll notice that the arcus senilis is far more pronounced, say from about here over to here, in other words, across the top. So you're dealing in particular with problems up to the head and the brain, and you're going to need to work on a number of different things here. I might add that doing the chiropractic type adjustments is only temporary. It's not enough just to pop somebody. We can pop Dana's neck in, but bottom line is if we don't correct the underlying conditions, it's just going to go right back out within a day or two in most cases. So this is where you have to get into the body electronics and really working on the point holding for the spine. Okay, if we can get the quiet down back there. Okay, now before dinner, Carol was asking a question about some of the yogic cleansing practice. Could you all be quiet, please? Thank you. Before dinner, Carol was asking a question about some of the yogic cleansing practices, using this like a salt type water drink and some of the other things. And at dinner time, in discussing this with John, he kind of pointed out a few things that we should probably mention at this point. You are going to get a cleansing effect of the body from a lot of different practices and things that you can put in the body. But the thing to consider is, are we putting minerals into the body? Are we getting enzymes into the body? Are we getting essential fatty acids, proteins, and other necessary substances into the body. And also just consider, are we actually bringing about an eye color change with this, with this technique? And those would be some of the relevant questions to consider. Now, I don't remember all of the stuff that you said there in terms of what they were doing, but I think we want to understand that there'd be a great big difference between cleaning out the colon or the small intestines or the stomach in the sense of actually removing debris from the stomach or removing debris from the gut versus actually doing things that bring about a regeneration of the system itself. There are many, many different techniques and practices that will do a fairly good job at removing stuff in terms of fecal material and mucus and whatever else is accumulating there. But if we're really going to bring about an actual regeneration of the body's own tissues, it's going to take some of these other things like minerals and enzymes and other essential nutrients in order to do that. And what a lot of people will do is they'll use a lot of the colon cleansing programs, and they'll get a lot of results with them in the short run in terms of getting rid of various substances or whatever in the body. But in the long run, it will be only temporary because they're not enough to bring about a regeneration of the colon. Does that make sense, Carol?
I was just suggesting adding it to the body electronics program, not replacing it. Just adding it to the program with your enzymes and minerals and everything. As we have colonics, if we have a regular colonic that's washing out the colon with water, I was just suggesting doing that, monthly or whatever, to wash out the small intestine along with the body electronics program.
Is the drinking of the salt drink, is it resulting in a fairly immediate or relatively soon resulting in like a bowel motion?
Oh yeah, sometimes within minutes. Depending if you're constipated, it might.
We have to consider
to the next day.
We have to consider the possibility then that what we may also be dealing with is a bit of a laxative effect, where a true laxative is actually an irritant to the system that the body is then trying to expel. And the long-term result of a laxative, of course, is that it actually weakens the system and one becomes dependent on it. So there may be some other factors to consider here.
Well, they say that the exercises open. They don't stimulate peristalsis. They simply open the valves, which are normally shut, preventing the food to going through at that rate. And what do I want to say? As a colonic will often decrease the peristaltic action, meaning that it might take a day or so for another bowel movement. But when you do this, it seems to just regulate the bowels to work better.
I would say in the long run, Carol, the thing to examine very, very carefully and keenly would be, is this bringing about any type of change in the iris structure, in either the iris color or the iris structure?
On its own, I wouldn't.
Right, because if it's not doing that, then it's not going to truly bring about the regeneration of the body. So.
But like a colonic on its own won't do that.
No,
will it?
Not in most cases. Although I have seen a few people who did repeated colonics. That I have seen the rare instance of a dark brown eye that was actually lighter inside the autonomic nerve wreath because the person was doing colonics every day. Yep. So.
I mean, you could use mineralized water.
That might improve things a bit. Esther?
Actually, I was thinking you could use mineralized water with a touch of Schweitzer in it and oxygen.
That would be wonderful.
With colon irrigation, you don't just do the irrigation. You have to put the people on a diet. So maybe the color change would come also because of the diet that the person is placed on. Colon irrigation on its own is, well, it's not very effective. But there should be a change of lifestyle and a change of diet as well if you want to maintain it. So.
Okay, I don't want to spend a lot more time on this. I just want to point the way for people to kind of think about this on their own. You just stick that one down there. Let's get the slides back on again. I think we can. I'm sure we can probably leave the doors open. It's dark enough outside. Come on up. And now a word from our sponsor.
Hello. I have some flax oil. I'd love to sell it tonight. It arrived today, which I discovered when I chanced to go in to Yungaboa, and I went in to the shop there, bought an orange, asked for a heap of change, told them my name. They couldn't miss wanting to know my name, of course, and I was out at Yungaboa, and she said, "Oh, parcel arrived for Yungaboa this morning." And I said, "Could be for Whistler." And it was. Most amazing thing. So that's the flax oil. Things are interesting. I have promises to Irmgard, Esther, Aniki. Promises? No, would you finish off that bottle? Is that enough to last you 10 days? No, okay. So I have a promise for Karen, it seems. Is there anyone else I've made promises to? You ask me. When you ask me, asking me is not a deal. You need to ask me when I'm sitting down at my desk and sitting down at the desk.
Could we have people see you right after class, or are you sort of in a healing crisis and heading for bed right now?
Okay.
Okay.
I just want people to come on a first whatever.
Right.
I want to sell the rest of the 6 bottles I have, which is...
Could people see you in the back of the class right now? Would that be possible? You've got to promise to a few people.
Anytime tonight.
Okay. Where's your desk?
The office is in the back right-hand corner.
Out back. Okay. Thank you, David.
No, I'm not the flexible.
Oh, okay. We're back to 2 mics, so the question mic's going to kind of stay right about there. That's the question mic. That's the one you'll be getting up and using when you have a question, Tom. It's kind of black with this round thing at the tip, and you hold it like this and speak. Yeah. That's the one. Okay. If we could get the slide up, Matthew, thank you. And if we could dim the lights a little bit. Do you want a mic back there?
No, I don't. I'll just
hit me in the head or something if you need it. Okay. Okay, we covered that one. If you could hit on to the next one, Matthew. Okay, again, another sodium ring. Is that enough light for everybody to write by? Okay, bring up the other one. Okay. Okay. We've got ourselves a fine sodium ring out here and a bit of an arcus senilis. Next slide. Okay, you see this bluish ring right out here? That's going to be your, according to the Jensen terminology, that's your anemia ring. It's going to indicate a poor oxygenation of the blood and the tissues. This is also what we might call a narrow blue ring. What you're also going to find in the sclera in a lot of people is a broader blue ring that will extend out maybe around this far or so. This will also indicate an oxygen deficiency, and we'll get into that a little bit later. But you've got the Jensen anemia ring, which is this narrow one right here, this blue ring. And you've also got a broad blue ring that might extend out approximately that far all the way around in the sclera. And we'll get into that a little bit later. Neville? Oh, I thought you had a question. Okay, next slide there. Yeah. I think this one's in the wrong place in the thing. One thing I would probably say about this slide is if you look at this, this is going to be a left eye. And you look at that nice kind of cigar shape right there, you're almost certainly going to be dealing with some sort of cancerous situation in the, that'll be in the descending colon. But obviously if you just look around the eye and you look at the various dark pigment spots, there's all sorts of places to work with here. This little stripe right there would be quite important, and this right down in this area. This dark one right there, but there's a lot of spots we could work on in this area. Okay, next slide. Okay, again, we've got a sodium ring here, and you'll notice how a lot of the sodium ring is covered up by the sclera. You've got quite an arcus senilis there. Can you all see that? Now, it's probably pretty advanced along the top. We just can't happen to see that in this eye. Next slide. Okay, again, quite an arcus senilis there. You see how far the sclera is pulled over the iris on the top? So we have very poor supply of what? Oxygen and nutrients and blood to the head and the brain in particular. Okay, next slide. Okay, once again, a good arcus senilis right up here. You all see that. Okay, next slide. Okay, again, you can see the arcus senilis right there. You see where the sclera is pulled down over the iris. Tarek?
Question. Could you say that people who have arcus senilis, especially on top very much, are a bit memory loss?
What was the question?
Could you say... You heard me.
Oh, yeah. If you've got the arcus senilis, you know, you're certainly going to have problems with a lot of the brain function. Often this would include problems with the memory and things of that nature, but it could vary a lot from one person to the next. But obviously, you're not going to be functioning on, on all 8 cylinders there because you're just not getting the blood flow up to the brain area there. Okay, next slide. Okay, again, another arcus senilis up in that area. Okay, you see this brown out here? Okay, that's what John will call your hamburger. This brown pigmentation in the sclera. You all know what the sclera is, right? The white of the eye. SCLERA, the sclera. The brown pigmentation or hamburger in the white of the eye is going to indicate problems with the gastrointestinal system. Problems with the stomach, the small intestine, the large intestine. And whenever you see this, you're going to have problems in those areas. Okay, next slide. Okay, I guess the only thing I'd want to say about this one is, what is the fiber level that you're looking at in this iris? What happens in the iris as the level of vitality and level of health at the cellular level? What happens as this goes down? What happens to the iris fibers? Okay, they go further backward. Once you're past pain where they've initially come forward, they're then going to start moving backward or further posterior. And what's going to happen to the coloration of the fibers? They're going to get darker and darker going towards black. Now, if you take a good look at this eye there, how much brown pigmentation is present in that eye? Virtually none. I mean, look very, very closely at that eye, and there's very little in the way of brown pigmentation. And yet look at how incredibly dark that eye looks. It doesn't really look blue anymore. It's almost like a navy blue to black, because what's happened to all of the iris fibers there? They've dropped way, way, way back there, way back into the pigment layer, so you've got all these black fibers. That's a very, very dark eye there. And what's interesting about it is that because you don't have the brown pigmentation and you don't have a lot of that white catarrhal stuff coating the fibers, you can really, in the entire eye, you got some of that catarrhal stuff, that white stuff on top of the fibers up in this area and in here. But overall in the eye, you don't have so much of that. So you can really get a sense, not just out in zone 7, but throughout the eye, you can get a pretty clear sense of how far back the iris fibers have dropped and what a degenerative situation you have in the whole body there. Can we get the next slide? Okay, another sodium ring there. Arcus senilis as well. And actually, if you look carefully, you can see the anemia ring there as well. You see that blue ring? Okay. Next one. Okay, we got an anemia ring right there. You all see that? Okay, next slide. Okay, another anemia ring right here. You see the bluish ring around the outside? Okay. Okay, again with an anemia ring right here, which I'm sure you can all see. And you got a good dark scurf from there as well as a good lymphatic rosary to deal with. Okay, next slide. Again, an anemia ring, a bit of an arcus senilis there as well. Nice dark scurf rim. Next slide. Okay, very obvious anemia ring. You can all see that blue ring around here. Okay, next slide. Bless you. Okay, another anemia ring right there. You can all see that blue ring up around there. Next slide. Okay, again, an obvious anemia ring, that nice blue ring right there. Dark scurf rim. If you look at the two sides here, a lot of times you're looking for deviations in the scurf rim where it's going to be thicker or darker in some areas and not others. I would caution you before you get too excited about this one that a lot of what you're seeing is just the shadow effect from where the flash is coming. The scurf rim is often going to look a bit darker and thicker opposite the flash just because you've got a shadow there. So you may not really have that much of a disparity from one side to the other. You'd really want to see either the real eye itself or see photos of it lit from both sides. I believe this is your microphone here.
Yeah. I do have one side of my scurf rim that is darker.
Definitely darker.
Than the other. Yeah. And it does seem to affect my lung area as well, where I've got a lesion as well. So that could be reason why.
Oh yeah, you can definitely have an area where it's much darker in the scurf rim, and that would be significant.
I find it a bit hard to differentiate between the beginning of the sodium ring and the blue ring around the iris.
You mean the sodium ring or the?
I'm pretty sure it's the sodium ring.
That opaque white ring.
Yeah, is that inside the scurf rim normally in the eye, or is
it's
that
actually kind of in front of the sodium ring? Is actually kind of out in front of your zone 6 and zone 7, so it's really going to kind of cover up this. If it's thick enough, like opaque, it will really kind of cover up most of zone 6 and zone 7. So like, for example, a person could have a lymphatic rosary or a real nice scurf rim underneath it, and you wouldn't be able to see them. The arcus senilis will actually then pull over in front of the sodium ring. So you really get confused there. But sometimes underneath the arcus senilis, you can still kind of detect the anemia ring, which is this blue right here.
Yeah, there's no
But
problem.
look for blue with the anemia ring. Yeah. Okay, next one. Oh, question, Donna?
Yeah, that's what I was saying before. If you have the person turn to their side, you could put the torch in this way, and it's like on top of the fibers. You can see the sodium ring.
This is one of the reasons that, and your iris fiber depth. This is one of the reasons why your better eye cameras will very definitely have the flash coming in from an angle instead of straight at the eye, because there's a lot of details that you're going to miss whenever the flash is coming straight at you. Like, for example, if you look at this eye photo here, you basically have a flash that's coming straight at the photo, so you're going to lose a sense of depth there that you would have if you had a flash coming in at a bit of an angle like this. What you have in this eye is a tremendous number of your closed lesions. You see all these things right here? These are your various inherited weaknesses. Now, when you look at a closed lesion, there's a couple of things to consider here. The size of the closed lesion is not really much of an indication of the severity of the problem. The major thing that you might learn from the size is that might give you a certain idea of what organ it is that the lesion represents. But the size of the lesion is not really all that significant in terms of how severe of a problem it is. There's a few things that will indicate a more severe situation with a closed lesion. One is when the lesion is more narrow. Like your kind of longer, narrower lesions are typically more of a problem than your shorter, sort of stumpier type lesions. Those long, narrow ones are a more severe problem. And in particular, the long, narrow ones that indent well into the autonomic nerve wreath, such as this. When your closed lesion indents way into the autonomic nerve wreath like that, that's going to be a more serious situation than one that's not going in quite so far. And the third thing that a third thing that you'll look for in a closed lesion, of course, is the fiber level within the lesion. If you see a lesion that basically just looks like a black hole where you can't see any fibers inside the lesion, like for example, you look right here, where basically you can't see much in the way of fibers inside there, You can see maybe like, a couple of fibers inside that one. But you look at the fiber color and depth within the lesion. If you start off with a lesion that's very narrow and deeply indented into the autonomic nerve wreath and very black inside the lesion where the fibers are very recessed, that's going to indicate a very, very severe problem. What's going to happen as the body heals up in that area is the lesion's going to become less indented into the autonomic nerve wreath. It's going to become less narrow and a bit kind of broader, and the fibers are going to start to move forward and lighten up in color and gradually fill in the lesion. You all have that? Okay, the lesion, as things start to heal, this is an inherited weakness we're dealing with, a genetic time bomb, some might say. As the situation improves, the lesion will get less deeply indented into the autonomic nerve wreath. It will get less narrow in this direction. It'll get less long and narrow and more sort of broad in this direction. And most importantly, the fibers within the lesion will get lighter in color and move up from the back so that they fill in the lesion. This is an indication that the problem is starting to come under control. Now, in traditional iridology, it's been believed that a closed lesion will never, ever, ever open up. It's been taught that this is an inherited weakness and that there's no possible way of overcoming it, that the best you can hope for is to keep it full of fibers. Starting back probably a little over 15 years ago was the first time that John actually saw a closed lesion open up. It happened in Huntington, West Virginia, to a woman by the name of Denise Irwin was her name. And since that time, there have been a number of individuals who have had closed lesions open up. What was the name of the woman? Oh, Shama had one. But what was the other lady that had Linda Edwards? How many people remember Linda Edwards from last year, where how many closed lesions opened up for her, Brooke? Do you remember? That's what I remember, was she had a couple of closed lesions up. She had a healing crisis right over there near the door one day, if I remember right. Bottom line, then, what is happening if you're opening up closed lesions? You're going beyond healing. What are you changing? You're changing your genetics. You're changing your DNA if you're opening up closed lesions. This is pretty revolutionary, and I hope some of you are starting to look at the implications here. Vivian.
But
Canada's not using it.
But that doesn't mean to say that the person actually has this problem, does it, Doug? I mean, it means that they might have it or whatever.
It's a genetic time bomb.
Yeah.
And if they don't do anything about it, they will eventually develop a problem there, unless, of course, something else does them in first.
Okay.
But the thing about it is that you can actually defuse the bomb before it goes off.
Great.
You can overcome the situation before you really ever develop a serious problem there. I wouldn't say you have no problem there, because the very fact, see, when you look at this lesion here, for example, see this part right here? That's the autonomic nerve wreath, but so is that. You see, the entire thing all the way around it is the autonomic nerve wreath. So it's like, if you think of what John talked about, where you've got the iris fibers that go from here out to the nerve wreath and back, and the others that go from the limbus into the nerve wreath and back. It's like you've got an interruption there in your lines of communication. You've got, right on a genetic level, you're programmed to not have proper nerve supply to that area. If the nerve supply is not what it should be, then the circulation isn't, the lymphatic supply and removal from the area is not quite right. I mean, everything's going to be a little bit iffy in that area. And if you think about this in terms of an island, it's basically, to some degree, cut off from full communication and full circulation with the rest of the body. So the very fact that you have a lesion, you do have some problem there. It just may not be obvious, and you just might not have a lot of symptoms there yet. But just the fact that you've got a lesion, there are definitely some things that are less than perfect there.
Right. So all this is the autonomic nerve wreath?
Yes, all the way around. Yes.
Right. Okay, thanks very much.
Okay, John?
Is every one of these a lesion?
All of the ones that are part of the autonomic nerve wreath and are surrounded by the autonomic nerve wreath, yes. So obviously in this particular case, this individual has a lot of a lot of opportunities here, as we like to say. There's
I
a
see.
lot of different inherited weaknesses to deal with.
Right. And since there's some fibers showing in those two, these, where there's fibers showing only halfway across, these are more worrying, more likely to produce something than these. Is that
Yes.
right? Okay.
Does this person have stomach cancer, and is this a sign of overacidic condition? This white banana.
Okay, on the first question, it does look pretty gray in this whole area here, so there may certainly be something going on with his stomach. But the way the lighting is on this eye, I think you're going to get some distortions in color. It's kind of a weird camera that the slide was taken in. Jensen will teach the concept of an overacid stomach relating to a particular color of the zone 1 ring. In John's experience, he does not believe that that is really ever the case. John will say that you really don't ever have an overacid stomach, so you're not going to get an agreement there. By Jensen's terminology, they'll often say, yeah, you can have an overacid stomach if you see like kind of a fairly white zone 1 ring. But, John's been looking at eyes for a long time, and he's of the opinion, and I have no reason to disagree with it, that you're really not typically going to have an overacid stomach. If you think about it, most people are in a state of subacute or chronic health. So it kind of makes sense that most people are not going to be secreting too much of the stomach acids. If anything, they're going to be underactive in their secretion of the stomach acids. And when you start to look at the ability of most people to digest protein, which is very, very poor, that's another reason to suspect that most people are really going to be the opposite. They're going to be underacid in the stomach rather than overacid.
The small diamond shapes, I was just wondering, with the discussion we had the other day about the diamond shapes and how they can be cancer, what about, there's quite a few of them there, and...
The thing about it, Glenn, is we could pick this slide apart all night.
You could.
Yeah. I think we'll go on to the next one, though. There's all sorts of things to deal with there. Okay, now, in this particular slide, I want to mention that one thing we've got here is we want to look at the overall constitution of the individual. What do you notice about the fiber structure in this eye? It's quite straight. You notice the eye fibers here. They're rather straight, and there's also quite a lot of them. You notice how the fibers are very, very densely packed. You compare this, if you looked at the last slide with all those closed lesions and sparse fibers and all the rest, that would be a very, very weak constitution. This, by contrast, would be a very, very strong constitution where you've got very straight, dense fiber structure. Think of the difference between like silk and burlap, where silk is a very fine, dense weave, and this would be basically like silk, and burlap would be very coarse and loose with a lot of holes and gaps in it. An individual with a strong constitution is going to tend to heal more rapidly in most cases. They're going to tend to have a lot more energy, a lot more vital force. They're going to tend to bounce. That doesn't mean that they're healthy. You can have a strong constitution and you may run yourself down into the ground, but overall, a person with a strong constitution is going to tend to bounce back quicker from things. They're going to tend to recuperate more rapidly, and all the rest. And of course, you'll get the opposite scenario with a weaker constitution. Oftentimes, a person's greatest strengths are their greatest weaknesses. And one of the things that you'll often have with a person with a weak constitution is that they will often learn at a relatively young age the importance of good health habits. And so a lot of times people with a weak constitution will live a pretty long and healthy life because they start taking care of themselves at a relatively young age. You get a person with a very, very strong constitution, and they're pretty used to being able to bend all the rules and not really notice much. And oftentimes they don't really, wouldn't be anybody here like that, Tom, would there? So you got a lot of people with a very, very strong constitution, and they might get into their 30s or 40s or 50s before they start to show any signs of wear and tear that are obvious to them. And the problem here is oftentimes with a strong constitution, by the time you start to notice it, you've really already pretty well fallen apart. So you can get a lot of, like I said, there's good and bad in anything here. But by and large, if you get a person with a real strong constitution such as this, and you get them on a real good program, they should heal up fairly rapidly compared to most people, because you just have a lot of really powerful innate healing abilities. Now, I would say in this particular eye, which is a right eye, I would say there might be one fairly significant weakness that you might want to consider with this individual, which would be what? Probably the pancreas, if you look right in this area. So even an individual like this is going to have, then there's other problems you could look at, but the pancreas would stand out right in that area. Simone?
This is just a question about the basic muscular structure of the eye. When you're looking at the open lesions in the eye, the dilation of the pupil, is that going to affect the size of them? You know how you can get...
Very much so, yes.
Yeah, I didn't know.
If you imagine this particular eye, for example, and you look at how straight the fibers are, if you got a picture of this, like if you took an eye photo of this person in the back of the room now, where the pupil would be quite, it'd be very, very large in this type of light, and it wouldn't have time to contract just from the flash. So imagine if this pupil was about this big, then all these fibers that are stretching from here to here are now only going to stretch from, say, here to here. So they're not going to be that straight. They're going to look very, very, very wavy. There's an iris sign or a pupil sign that you'll see in a number of people, which is where the pupil does not contract down in the presence of light like this, and it tends to stay quite large. Okay, some of you are aware of people, maybe yourself, where you tend to have a rather large pupil that doesn't go down. That's a sign of adrenal exhaustion. Adrenal exhaustion. If you get an eye photo of somebody with adrenal exhaustion, you really don't get an accurate picture of what their constitution is. I'm glad you asked that, because you simply can't tell how straight the fibers are, because they're all basically going to be all wavy, because they're only going to go over half their length there.
Okay, so when you get when you're comparing two sets of photos, it's a good idea to have a look at just
equal
the
pupil size. Yes.
Yeah. Okay.
This is again why with an eye camera, it's very, very important that you have some sort of focus light that's shining on the eye before you take the shot, that's quite bright, bright enough to get the pupil down to a normal, relatively normal size such as that. Because otherwise you get all sorts of distortions in the iris, and it's very difficult to read it, because you compress the iris into this much space instead of this much space. Yeah.
With the pupil size, wouldn't it also tell you something about the central nervous system? If it wasn't, the reflexes of the pupil, if it wasn't diluting and whatever.
I know one. That's possible. I know one thing that you will see in the pupil sometimes is you'll see places where the pupil's kind of flat. It won't be round all the way around, but you'll have certain. You might have a certain area of the pupil might be flat across a certain area. And that would mean that the corresponding part of the body would have kind of a relative lack of nerve supply. And I have seen situations where you would have a flattened pupil there like that, and if you then adjust the appropriate part of the spine, the pupil will go back to a normal size, or normal roundness, of course, until the spine goes out again.
Another thing about the color of the pupil, it's very white. Is that an acid wash, or is this person
the pupil?
in a huge healing crisis?
You mean the eye?
The fibers itself.
The iris fibers there. I'm not quite sure. They may well be. What you'll typically see in a healing crisis is you'll see that the iris fibers will move very far forward and be very bright white as the person goes into a healing crisis. And the entire body will support the healing crisis. So you're going to see this situation throughout the entire eye. I have seen situations. I've seen situations where people with brown eyes, like relatively dark brown eyes, have. Tarek and Lewis, do you remember what Charles Cole's eyes looked like there after that one healing crisis? Did you guys both see that? Now, were you there that week, Sama? Okay, do you remember seeing his eyes? Okay. We had this one individual in Pennsylvania in September. He went into an absolute massive healing crisis, actually really well before his point-holding session. And he had a very, very dark brown eyes initially, and with some lesions and things in him. And he was a black man, and just quite dark eyes. And he went into a massive healing crisis, and if you looked at his eyes there during the healing crisis, and you looked at the lesions within the eye, they didn't even look remotely brown anymore because the white fibers had come so far forward that the lesions themselves would look quite bright white. Now, you remember that, you guys? One was in the heart, and I'm not quite sure where the other one was. But you had tremendous... Do you remember? Yeah. But it was very, very, very striking there. We had a few others that had the same thing. But bottom line, in a healing crisis, the fibers are going to move very far forward. Just to reiterate something that we've already heard a couple of times, but so you all remember, when you got a good healing crisis, you're going to, with a fever, you remember you're going to get that extreme burning as you touch the forehead, but then you're going to get that coolness as you back off on that. Now, Lil here has been in a good healing crisis for most of the day. It's kind of started yesterday, but it seems to have accelerated through most of the day, and she's sort of been hanging in there, hoping that people don't step on her. And we've been checking on her throughout the day, and she's consistently had a very, very hot forehead whenever you touch it, but every time you back off, it's quite cool. So we know there's nothing to worry about. She's in a good healing crisis. Now, if somebody were to go over and check out her eyes at some point, what you would probably find is that you would have a lot of very, very bright white fibers, just really, really moving way forward in the iris, because she's obviously in a good healing crisis. And the whole... now, did you check... Come on up, Ian.
Yes, Doug asked me to feel Lil's forehead just as we broke for lunch. And I must admit, in my experience with feeling the healing crisis, that's the most pronounced forehead I've ever touched.
How cold was it? Was it quite cool when you pulled off?
Very cold. Like very pronounced cold when I moved my hand away. And then as Doug walked away or turned to someone else, I asked Lil to show me her eyes. And there's a white ring from, say, the edge of the iris going halfway into the pupil. Very pronounced. Very white.
So the fibers are just popping out.
Yep.
Thank you, Ian. Tom?
The person you were talking about back in Pennsylvania, and was that as bad as what Lil and David are going through?
I don't know. He whined quite a bit more, but I don't know.
Now,
it's pretty relative.
In that case, did you hold points on him then, or would you hold points on a person in that crisis?
He happened to be due for his session anyways. I think it's often sometimes everybody needs their sleep. It's not. So you got a lot of other factors to consider, but a lot of times when you're in the middle of a good healing crisis, that's quite an opportune time to get your points held.
It can't be counterproductive. I mean, it can't.
If you're really exhausted and really, really whipped, there is a time to just go to bed. There's a time to just rest, drink a lot of fluids, and do whatever your mom would tell you to do. There's a time to just kind of hang out and not overexert yourself. But there's other times with a healing crisis where it might be quite appropriate to help the person through it a bit quicker with a little bit of point holding.
So we should hold points on Lil since she's not whipped.
It might be a good idea. We'll have to check with her. We're going to probably go till about 9 o'clock or so tonight because I think people are does that sound good for folks, about 9 o'clock?
Sounds good.
So we'll check in with her at the end there and see how she's doing. But you want to recognize that there's a time and a place for everything. And see, Lil's been more or less kind of taking herself through her own healing crises ever since this morning. She's been holding still and burning and all the rest. So she's kind of been having her points held by the universe most of the day anyways, it appears. So we'll kind of leave that up to her.
On, Lil. Don't try to be cachet. Get out of this thing.
Okay, at any rate, why don't we get the next slide there? Oh, sorry about that. Vivian?
In a healing crisis, you probably wouldn't want to eat anything or anything. You'd feel too rotten probably, wouldn't you?
You really, in order to get through things, in order for the body to heal and make it through the healing crisis, you need nutrients. You need minerals, you need enzymes, you need things.
That's what I wanted to ask.
Yeah, no, you have to have your nutrients and some food. Yes.
So you've got to force
and that keeps you going. Now, some people try and pull themselves out. Like I said the other day, like having a banana split in our ice cream sundae or hot chocolate or something, and they try and say, "Hey, I don't want to go through this anymore. I want to get out of here." But no, you should continue with a good diet and your supplements to pull you up through it.
Right, but you could just eat fruit and have your supplements if you didn't feel really... I mean, because I imagine you don't feel hungry. I mean, I don't know, but I would imagine you don't feel hungry at all. Or do you?
I eat.
Oh, do you? Okay.
There are times where it may be wise to eat fairly lightly. You know, you don't want to go out and have something really greasy or heavy, but you're probably going to need to get a certain amount of food in you, and you very definitely want to get all your supplements down. Basic principle, as always, here is whatever gets you into the healing crisis is what will get you through it. So if you find yourself in a good healing crisis and then you stop doing all the stuff that got you into it, you're probably not going to make it through it. You're probably going to just eventually slip out of the healing crisis back down to the same balance you started out in, and then you haven't really accomplished a whole lot. So it's best to really, once you're into it, you might as well go through it.
Okay, thank you.
Yep. Okay, Brooke.
Or you can take Brooke's law and just triple everything, get through it a lot quicker.
When in doubt, do more. Yeah. But it often helps you to. It oftentimes I would say if anything, it would certainly be better to do a bit more supplements than a bit less. Oftentimes you'll be just fine at the same level you've been at all along. You don't necessarily have to do anything more, but in most cases it won't hurt, and it may well help you to get through it. But I have seen people stop taking supplements, and they often end up basically stalling out in the middle of a healing crisis, and if anything, they just end up feeling worse for a longer period of time rather than getting through it.
Yeah, I was thinking diet-wise, definitely keep it light, because one of the first things that shuts down when you're in a healing crisis or with a fever is your digestive system, because it goes out. You know, all your energies are used on the fever and fighting that.
But even with fairly light food and smoothies and things of that nature, it's still quite a simple matter to get lots of minerals, enzymes, flax oil, and various other things, down. Okay. There's a few things that you want to look for when you're looking at the fibers in the eye. You want to look for deviations from the norm within that individual's eye. And a couple of specific things that you want to look for with fibers. You want to look for anything that's basically irregular at all. And I'll give you a few suggestions here. You want to look for fibers that you might consider to be abnormally crooked or warped fibers. Like, for example, look in this area here where you have a lot of spreading in the fiber structure. Like as you sweep around, you'll notice how this area kind of stands out. So you're kind of crooked or warped fibers. You're often going to have some sort of swollen type fibers. Like, for example, look right here. See this fiber right there? How it's kind of bigger than most of the others? So some of your swollen fibers will indicate something. A lot of your kind of I guess you could say sort of your bright, some of your fibers that sort of are kind of like bright white and standing out will be significant. You want to look for basic like holes or gaps in the fiber structure. Up in this area you've got some gaps, some definite gaps in the fiber structure up right here, where these fibers are kind of displaced like that around a bit of a hole right in that area. And what's that? Right up in that area, yes. Basically, you want to look for sort of deviations in iris fiber structure. You want to look for anything that's out of time and out of place. You're going to occasionally see some fairly odd things in fiber structure. You'll remember, of course, that your average fiber is supposed to be running in this direction. You'll occasionally see fibers that are just totally out of context, like a fiber that's just running across like that. I've seen fibers running from here across the pupil to there. I mean, you'll see all sorts of odd things if you look at enough eyes. And just the thing to consider is that anything that is out of harmony with your sort of perfect type iris structure is going to indicate some degree of abnormality. I've even seen one of the oddest things I've ever seen in an iris was a person whose autonomic nerve wreath, he had a very, very narrow autonomic nerve wreath to start, and across the top it was also prolapsed to where the part of the autonomic nerve wreath actually dipped inside the pupil. So you can get some very, very bizarre things if you look at enough irises. And when you find something like that, that's usually quite a significant thing. Why don't we get the next one here, Matthew? The next. Well, that's a fun one. Now you see a lot of swollen type fibers here. A lot of again, this is one of those eyes, by the way. How much brown pigmentation is present here? Hardly any, and yet and yet, as we like to say, where's the blue? Where does the blue come from in an iris? Brooke?
It comes from the back of the stroma. Back there where it actually reflects off the back. You've got a handout that'll show you a cross-sectional view of the iris, and it'll show you the different depths, and it'll show you a part. Can't get the name of it right now.
The posterior epithelium?
Thank you. And what it is, it's like a really deep, dark sort of, it's almost like a violet purple colour, isn't it? It's really, really deep colour, and that's what reflects the blue off.
And then where's the brown? In relation to the iris fibers, where's the brown?
The brown's usually on top of or anterior, if you like, forward on top of the fibers, whereas the blue colour's reflected, posterior, if you like, at the back of the stroma. The brown in the eye is basically sitting on top. And again, what Anita was pointing out earlier on is that when you look at it from the side, you can see the raised sort of colour in I know in my eye you can see that pretty easily.
So if you've got an eye such as this, where there's virtually no brown pigmentation there, and yet there appears to be very, very, very little evidence of blue, what does this tell you about the depth and color of the iris fibers here?
You're asking me, I take it?
Yeah.
What it's suggesting is that, or what it's showing is that the fibers are clear back into the stroma. In other words, they're pushed right back.
And what color will they be?
Basically, they'll be black. They'll be level 7.
The fibers are very, very black here. It's easy to get confused. Remember we've talked earlier in the week about the different fiber depths and colors, where you went from white to bright white and then back through the shades of gray to black. It's very, very easy to get confused on the fiber color, because even in an eye like this, where the fiber color really is quite black, you have a certain amount of catarrh, or sort of acid metabolic waste that's built up, and you see this kind of white coating on a lot of the fibers, or actually in this case more or less a gray coating. You don't really have gray fibers there. What you have is black fibers with sort of a whitish gray type substance that's kind of obscuring them.
Yeah, it's still a build-up. All that white is still a build-up on top of the fibers themselves.
Okay, what would be the overall constitution of this individual? No, not the level 7 does not refer to the constitution. That level 7, levels 1 through 7 refer to the fiber depth. You can have a horrible constitution and yet have fibers that are pretty far forward. You could have a great constitution and yet have fibers that are very, very far back, so that the two are independent. What is the overall constitution of this individual? It's mixed to weak, wouldn't you say, Brooke?
Yeah, well, I mean, if you're a panel beater and part-time job as an iridologist, you call that a 60 grit sandpaper. That's pretty coarse fibers there.
Next slide. Okay, that's if you look at this individual, you can see a fairly dark scirphrem out there. Not black, but fairly dark. Look in through all this area, and at first glance you might think that you're seeing kind of like a white or a gray type fiber. But if you look very closely, the color that you're seeing there, you see the same color both where the fibers are as well as in the spaces between them. Do you see what I'm saying there? So, okay, look very closely at the fibers here, and this kind of hazy white color that you see, it's virtually the same color both where the fibers are as well as in the spaces between the fibers. So what you're really dealing with there is a catarrhal coating that's obscuring the fibers there. A lot of people see an eye, like you get a lot of people with a blue eye like this where it's very, very cloudy, and the eye looks pretty good at first glance. You get them on a program for a year or two, and a lot of that catarrh lifts off, and you start to see the underlying fiber structures, and then you realize that you didn't put them on a heavy enough program to begin with because they're a lot worse off than you thought. It's similar to a lot of brown eyes, where if there's a very, very dense brown pigmentation, you don't really know exactly what's underneath it, and sometimes by the time you've stripped off a lot of that brown, you start to really worry because you realize you got more problems than you knew about there. Catarrh is by definition acid metabolic wastes that are settled out in the tissues. And it can be reflected in the iris oftentimes by a lot of this sort of cloudy stuff that's kind of coating the fibers. Brooke?
With the catarrh, you like that's kind of a solid form. It's really quite solid in between the interstitial spaces or in the tissues themselves. To get that out of the body, it breaks itself down into more of a phlegm or a mucus, more liquidy to actually get it out of the body. And just so you understand that, it's important that there's several processes it has to go through. It just doesn't come out in one lump sort of thing. It has to get broken down.
What happens sometimes to people with a lot of catarrh when they get in a real good healing crisis and maybe have a spinal session where they're face down for a couple of hours? You ever seen that? What happens?
I'd say sinus heaven.
But what comes out of them?
Oh, basically buckets of mucus.
How many people have seen people lying face down on a point holding table and just absolutely amazing quantities of like junk flowing out of their nose for hour after hour during a point holding session? Mm-hmm. And you start to wonder after a while, where did all this stuff come from?
Yeah, it's pretty amazing. I've sort of been on a whole, I was talking to a few people earlier on today about being on a whole different types of cleansers. And at one stage I was on one where I started, all this phlegm started and mucus started coming out of the nose and even the ears and the mouth and everything. And it just didn't stop for about a month or two. And I was really amazed at how much is in the body. It just really made me realize.
I've seen people completely soak maybe 20 or 30 Kleenex in a single point holding session. Absolutely completely soak them, where you just have a pile of them on the floor and the stuff just keeps flowing and just keeps sopping it up, and it's absolutely amazing the amount of the stuff that can come out of the body when you go into a good healing crisis.
Just check out the bag down there beside Lil,
Oh yeah. She's been doing good.
Yeah.
Donna.
I was told that a thimbleful of catarrh was like a cupful of mucus. Is that true?
What I've heard is like the crystal catarrh, the hardened stuff. What I've heard is that approximately the amount that would be like maybe the size of your like little fingernail, that if that was fully liquefied, it would be like a cupful. That's what I have heard. Yeah. Okay, why don't we get the next slide there? Oh, okay. Why don't we get the lights on for a minute here, and we'll go on to tray 3. John?
Are the terms...
Video. Go ahead.
Are the terms catarrh and mucoprotein synonymous?
Definitely not.
No.
Totally different substances.
Please explain.
Catarrh and mucoprotein are totally different substances. Are apples and oranges synonymous?
All right, well, what's the difference in appearance in the eye, in the iris?
The mucoprotein you're going to see out in zone 6, and then moving into zone 3, as we've seen on all the slides. It's going to be your little spots and your lymphatic rosary and your tevectili and all the rest, which is totally different than your sort of overall, white or gray cloudiness that you'll see in the fibers. Yeah. Okay. Again, we've got a slide here where you've got a fairly dark, recessed fiber structure there. I might mention a couple of other things very, very quickly here. When you're dealing with a very, very strong constitution, a couple of other things that you'll find is that this will be an individual, on average, who'll have a longer life expectancy with a strong constitution. most likely this will be an individual that will have a lesser need for sleep. This will be the kind of person that can get by on 2 or 3 hours of sleep a night and do that for years. And, well, they often that's the sort of the downside to the strong constitution. You often kind of burn yourself out by pushing yourself too hard. And oftentimes this will be the person that will take the, as we've said, the longest time to break down. I want to kind of clarify something here. The physical body, to a very great extent, is an outer manifestation of inner consciousness. We have a lot of energy overlays that are involved, where we've got the natural man, which is the soul level, the constitutional man, which is the genetic level, and of course your entity involvement. One of the biggest mistakes that I think any of us can make when we start to look at the iris of the eye is to compare ourselves to other people. This is pretty inevitable. I mean, most people, when they start to look at eyes, are going to start to look at their own eye and look at other people's eyes and start getting into concepts of better and worse and all the rest. The thing to realize is, better or worse for what purpose? We all have our own unique lessons to learn. And certain bodies will be absolutely perfect for the lessons that we're trying to learn, whereas another type of body that someone else might have would be a very poor body for us to learn the lessons that we're trying to learn right now. So don't make the mistake of thinking like, oh, a person with a strong constitution and a blue eye is necessarily any more evolved than anyone else. That's just the type of body that they need right now to learn the lessons that they need to learn. Somebody else might need to be born into a body with very dark eyes. Somebody else might need to be born into a body with a very poor constitution. Every body is going to have its own unique challenges. Every body is going to have its own unique opportunities for growth. And none of them are really better or worse if we compare them around. It's really just it's very relative. If you, for example, have a tremendous resistance to being if you have a tremendous resistance to other people taking care of you, and you're born into a body with a very strong constitution, well, you're not going to be able to manifest it as easily as you would in a very sickly body. So you'll have to come up with probably some other way of manifesting it, like perhaps some sort of serious injury. Right? So there's all sorts of different variations here. But the bottom line, I think, in all of this is just a good friend of mine actually phrased it very well, actually. And I think this does apply to the different irises in the class. When we really look around, because I know a lot of people look at their own eyes and they look at somebody else's and they say, boy, I'd really like to have that person's eyes. Or, of course, they might look at somebody else's and say, boy, I'm sure glad I don't have so-and-so's eyes. But the bottom line is that ultimately, if we really look at it, we've got absolutely the perfect eyes and the perfect body and the perfect opportunity to learn the lessons that we need to learn. A good friend of mine told me a little poem one time. I'm not sure if she made it up or not, but I think it's kind of nice. And it's a very simple one. She said, if all our troubles were hung on a line, you'd take yours and I'd take mine. You like that one? If all our troubles were hung on a line, you'd take yours and I'd take mine. And I think that's the thing we should really consider here. We've got the body we've got, warts and all. I mean, we've got whatever problems we've got whatever opportunities we've got. And the body that we've been blessed with is the greatest teacher that we're ever going to have. For those of us that might be, shall we say, a little bit less than grateful for the body that we've been given, at least from time to time, please consider that there are billions and billions and billions of intelligent souls that would gladly take on the body that you've got. There's many souls out there that are standing in line waiting for the wonderful opportunity to be given another physical body that they can have the opportunity to progress. It's very difficult to make much progress without a physical body. It's you can go up and get a little bit of instruction and a little bit of fine-tuning in your understanding between embodiments, but really after a certain point you can't go very far without a body to experience life in. This is why, as John has consistently said down through the years, the physical body is the gateway to spirituality. This is the greatest opportunity that we'll ever have to be in a physical body. And a lot of us, I think, frankly, and I include myself in this category at least sometimes, a lot of us are not really as grateful for the opportunity as we might be. A lot of us are kind of feeling sorry for ourselves, especially as we start to look at the eye slides and you start to hear what certain things mean and you start to look at your own photos and realize that you're looking quite a bit like the slide up on the screen sometimes. That's why we get some wonderful healing crises during Iridology Week. But the bottom line is we have a lot of opportunities here before us. And there's certain lessons that we can learn in no other way than through experience, through the actual experience in the flesh of going through these things. There may be a few things here and there that we can learn vicariously, but most of the lessons that we need to learn, we are going to have to learn through our own experiences. Well, if the shoe fits. Most of the time, Tom, we teach best what we need to learn ourselves. So that's the thing to consider, and most of us here are, in a very, very real sense, still in kindergarten. I like the way Jenny said it. She said she felt like she was down at the bottom rung, or maybe at least reaching for the bottom rung, and I think it's important for us to understand that we've all got a long way to go. And when you look at the iris of the eye and you start to consider what, all the layers of meaning in the iris, even those people here that in the past may have assumed that they were incredibly healthy start to have some second doubts about it when they start to learn a little iridology. And we start to realize that maybe we're starting down quite a few rungs lower than we originally assumed. And I think in the spiritual sense that's true as well, where John, has made the statement that we're all, 99 or 98% reactive, and if you argue with that, you're 100%. And, again, for many people, that's a very, very strong statement. Many people would think, oh, gee, I'm sure I got a few programs here and there, but most of the time I'm making up my own mind. I'm my own man. That's how most people will approach it. But the thing to realize is for any of the people here that have have done body electronics for a long time, and particularly the people that have gone through the visualization and consciousness courses, if you do this long enough, you'll hit a certain point where you'll seriously wonder if you've ever done anything that was really a choice. You'll start to wonder if you've ever really done anything that was actually not a programming. If you hit that point there, Jim? You ever hit that point where you wondered if you'd ever really actually chosen anything or if it was all just programming? That's progress, actually, Jim, because you probably went in there 99% and came out 98 or 97, so you're heading in the right direction there. Have you hit that point, Mag? Yeah. Great fun, isn't it? Some of you here probably are already hitting it, especially those of you that have gone through the cranial once or twice. If you haven't hit it yet, well, you got something to look forward to, I guess. Why don't we hit the next slide there? The next slide. The other next. Okay, what do we have as an overall fiber level here? Very obviously level 7. Now, is everybody clear on what happens with the 7 different fiber levels? Okay. Why don't we what slide number is this, Matthew? '68. Okay. The rest of the slides are on the different fiber levels. We're just going to kind of whip through these, and then we'll get the lights back on and finish up with a little bit of talk on the different fiber levels. So basically, you can all see this is a clear level 7 black scurf rim. Okay, next. Next. We got 2 in there. to about a level 6. You see that right out here? Okay, let's notice the certain areas where the fibers are very dark, like these lesions right in this area. Is this a right eye or a left eye? So one of the things that we're certainly going to be dealing with in one of these lesions, probably that one, is going to be what? How about the pancreas? Pancreas will be a key concern here. Notice this structure right here in the autonomic nerve wreath where it goes way, way up at approximately 12 o'clock. It's a very, very important part of the eye that we'll deal with a bit later called the animation life center. Animation life center. We'll get into that a little bit later. Next slide. Okay, again, you can see kind of a dark gray type scirphragm out here in this individual. You can see a bit of an anemia ring there as well. Notice, just sort of sweep around briefly and just notice all the different types of deviations in fiber structure and placement. Areas where you have gaps or holes in the fibers. Areas where, where things are spread out or crooked. Fibers that kind of run across. Got a lot of different distortions here. Does anybody see this right here? This kind of pink thing? Can anybody see that as I trace it in? Okay, that's not even an iris fiber. That's actually, you got another one right here. You got another one right here. These are actually transversals. These are blood vessels that have moved up to where they're parallel or even in front of the iris fibers. We'll have some better slides of those later on, but you got all sorts of deviations in there. Next slide, Matthew. We'll get to it, Tarek. Means trouble right here in River City. Okay, again, you've got a relatively dark scirphragm there, an anemia ring. Sweep around and notice certain areas, like down here, for example, where you've got deviations in fiber structure. Some very dark lesions right in this area. Where might that be right there? Gallbladder would be a good one right there. Okay, next slide. Okay, look at some of the lesions, and in particular, look at the differences in terms of what the depth and the color of the fibers is within the lesions. Look at how some of the lesions, like, what do you notice about this lesion? Very narrow and very deeply indented into the autonomic nervous wreath. A more serious problem there. Okay, next slide. Okay, again, a pretty good scirphragm. Notice how within the eye there will be quite a variation in fiber color and fiber depth from one place to the next. Okay, next slide. Okay, again, a lot of variation in fiber color and fiber depth throughout the eye. Overall, very definitely a black scirphragm, level 7. Okay, next slide. Notice how the scirphragm is quite thick and dark here where the lymphatic rosary is moved way in. Okay, a little bit of a sodium ring building up here. Okay, next slide. Okay, you got your anemia ring, your scirphragm. Next, notice all sorts of deviations and abnormalities in the fiber structure all through here. All these little black holes and swollen fibers and gaps and crypts in the fiber structure. You got a real mess over here. Probably the whole heart and lung area right here. This would be a left eye. You all see all that? Okay, the medulla up in that area. This whole area right in here. That right up in that area. This over here. Lots of little gaps and crypts in the fiber structure all down through here. You see all these things? Every little thing is going to have meaning there. You could take hours and hours just on one photo like that and pick it apart. But we won't. Next slide. Okay, again, an anemia ring, bit of a scirphragm there. Next slide, Matthew. Okay, what's the overall fiber level here? It's not too bad compared to a lot of the ones we've seen, is it? It's not real bad. It's a little hard to tell because it's a brown eye, but if you look out here in zone 7, it's really not that dark of a scirphragm, is it? Okay, next slide. Okay, if we could get the lights here. I want to wrap up briefly tonight by talking about the different fiber levels and fiber depths. Now, you should all have a page in your handouts that's got 4 different columns on it, where you've got the scale of emotions, the glands, the level of social responsibility or social involvement or whatever that column was, and then your fiber levels. You all remember that one? Okay. You've got your... Okay, we got the scale of emotions leveled numbered from top to bottom, where 1 is going to be enthusiasm, down to level 7, which is unconsciousness. What is the color of the iris fibers at the level of enthusiasm, level 1? Okay, you're going to have a white fiber. Now, when you go from enthusiasm to pain, level 2, what happens to the level of activity within the tissues? It increases. You're all aware of that? In other words, you go into a hyperactivity, an overactivity. So what is the fiber color? Okay, it's going to be bright white. What's going to happen? What's going to happen to the level of tissue of activity within the tissues as you go from pain to anger? What's going to happen to the level of activity in the tissues? Will the body stay in a hyperactivity indefinitely? No. After a while, if it can't win the battle, it's going to drop back a bit to survive to win the war eventually. So what's going to be the more or less the color at this level? Some will say it's white, some will say it's kind of a light gray. Visually, it's very difficult to distinguish. Okay, you'll see it written, in different handouts. It's been written differently, but we'll say it's possibly a white or possibly a very, very light type gray. What's going to happen as you continue further down the scale to the level of activity in the tissues? It's going to get lesser and lesser and lesser. And what's going to happen to the color? Okay, it's going to get less and less and less. So you're going to go to gray, dark gray, very dark gray, and black. Now, if you take the iris of the eye and you're looking at the color of the fibers, you also need to consider the depth of the fibers. The level 1 here, where the fiber is white, we'll consider that kind of our baseline. Where are the fibers going to be? Are they going to be towards the front or towards the back? They're going to be fairly far towards the front right here at level 1. What are the fibers going to do as they go to level 2? Are they going to move forward or back or stay the same? No, they're going to move forward. Because you're going to bright white, the fibers are actually going to get bright white and they're going to move further forward, which is going to indicate your hyper or overactivity. So for example, when Ian looked at Lil's eyes there earlier today, her fibers pretty much overall were bright white, meaning they'd move further forward than they would normally be. Did they look that way to you? Okay. That's a hyperactivity. What's going to happen to the fiber level as you go from level 2 to level 3? What direction are the fibers now moving? Backwards, and where do they end up? They actually end up roughly the same at these two levels. The depth, the fiber depth, in other words, it's like you started off here at level 1, You move further to the front at level 2, and then you drop back at level 3, and you actually end up in about the same place. And then as you move to level 4, what happens? Now you're really moving back, and you continue on back towards level 5, 6, and 7. So the fibers are getting further and further back, and you're going to lower and lower levels of metabolic activity. What would be another term for the bright white level if we're talking about tissue activity? We would call that an acute level, okay, or an overactivity. Once you drop down below that, what can you call it now? You call it subacute, which would correspond to somewhere in here, level 3, level 4, somewhere in there. How much symptoms do you have, by the way, when you're at the acute level? Lots of symptoms, right? How do you feel? How do you feel, Lil? Right, okay, we got the hologram. So, how do you feel when you drop down to the subacute level? No, you feel pretty good, because the symptoms have been suppressed. You fall down to to this range right here, you're subacute. You don't have a lot of symptoms. You start moving further down the scale, and you start to all of a sudden develop what will be called chronic problems. And then eventually, by the time you get to the bottom, you've got degenerative situations. Most people who feel like they're in good health are where? Subacute. Most individuals who feel like they're in a pretty good state of health are subacute in most areas, meaning they're falling apart, but they don't know it yet. Okay? Some people have already fallen apart and are well aware of it, and they're further down the scale. As you come, Sakara? Okay. Do you all basically have the picture on this? Are there any questions?